But if you look closely, you'll find there are many similarities and there are also differences. They teach, if you look carefully, many things which are similar. But focus on the giving, because this is the time when, if you're a Christian and you're focusing on Christ's death, then you'd understand the import of it. Now, Lent has come to an end. It is a period when it's supposed to be 40 days, remember, of Lent. Ramadan, 40 days of fasting. But if you look at the Muslims and how they go about fasting, man, they do a beautiful job of it. It's a time they give.
That everybody must participate in the
Yes,
fast.
everybody
and
participates.
breaking of the fast.
Yes, everybody participates. Now, we have learnt, I'm sure Christians give, maybe following the principle of the left hand should know the right hand is doing. But it's something that we must talk about later.
Yeah.
How it is. Not, forget coronavirus.
The one that has received from the right hand will know that
they have received, yes.
Yeah. So you don't need to say, but the person who's received will definitely.
Yes. You see, the thinking behind it was so that those who are disadvantaged in society actually get to be looked after. Yes. Now, I want to be looking at this later on and how much the Hindus have their way of doing it and they do it. We want to look at the Christian participation in all these things.
Yeah.
Yes.
Today, all media houses in the country, we stand with Kenya and Kenyans. But let's first take a look at what's happening around the world. The numbers. COVID-19.
Right, surge, and we saw some of the worst numbers this week. U.S. Surgeon General over the weekend had said that this is where it was going to be. Now, let's look at what the actual numbers tell us. We're at 1.5 million already, and seeing that this is what was forecasted. So a little over 1.5 million cases around the world. And if we look specifically at the new cases, or deaths rather, we're almost at 100,000 deaths, 12,000 shy, 88,502 deaths, 330,589 of those cases that have recovered. Focus is still on the United States. And if we look closely at some of those numbers, it's actually very interesting, because yesterday alone, in the US, the cases that we saw, the highest number of deaths per day to date, 31,935 new cases, 1,940 new deaths in the US just yesterday. And we see some of those numbers still coming out from the rest of the world, but this is absolutely the highest. They've seen that they're hoping that the numbers will now start to decrease. Less and less hospitalizations are taking place, because they do find that quite a number of people, even though they do have symptoms, are mild symptoms, so they can actually have home care. But unfortunately, the health system, the hospitalization process is not as good as they would like to see. President Trump came out the other day and said that they're hopeful that they would get, I think it was 100,000 ventilators to spread around the country and even to give to other countries, because they realized that this was of utmost importance.
So what are the numbers in America alone?
Okay, so let's look at the numbers in America alone again, and the total that we see today, just a second, by country. So the United States, 435,000, up by 39,000, because yesterday we were just under 400,000. 14,795 deaths. And Spain, again, we see 148,000. So the U.S. has the highest number of cases in the world and has tripled the follower. And the follower in this case being Spain, but has triple the number of cases that Spain has.
And the number of deaths in Spain?
The number of deaths in Spain, 14. The number of deaths in Spain, interestingly enough, is equal to the number of deaths in the United States. With a third of their cases.
But their deaths are more.
The deaths are more. So
also 14,000.
Yes, 14,792 deaths in Spain, 14,795 deaths in the US.
Wow.
Italy, 139,000 cases, but 17,669 cases. So a third of the deaths in the cases in the United States, but more deaths in Spain by 3,000, almost 4,000.
Tells you that America hasn't peaked yet.
No, not yet. And this is what the Surgeon General was saying, which, when he said this, maybe his tone was not as flamboyant as that of the US president, but he was quite grounded in what he was saying. And he said, this is the week where we're going to see some crazy numbers, guys.
Yeah.
And
especially because they have tested so many and it's a vast country. You'd expect that these deaths are going to...
They'll surge. 300 million people,
my goodness.
Yeah.
Oh, yeah. This is big. This is big. Africa?
Well, okay. So if we look at countries around Africa, still around the continent with under 40 deaths of all 54 countries. Every country in Africa now is officially affected by this. Everyone has at least one case. We saw more cases in Kenya yesterday with an additional 7 cases in the country. And if we look at the highest numbers, we're looking at South Africa with 1,845 cases and 18 deaths. Algeria, 1,572. Egypt, 1,572. The deaths a little bit more in Algeria and Egypt with 205 and 103 respectively. Morocco, though, has...
Deaths in Algeria and Egypt at 200.
205 in Algeria, 103 in Egypt.
Deaths?
Yes.
Wow.
Yeah. Morocco with 1,275 and then 93 deaths. But you also must realize that the only thing that separates these North African countries and Spain and Italy, for example, is the Strait of Gibraltar.
Yeah.
So people are able to, you can do a 20-minute flight between Tangier and Madrid, for example. So it's a very short distance. So you can imagine, and then there's always an influx of people between the two countries, between Italy and Spain and Morocco, Algeria, Egypt. So it's a very short distance. So this could be explained that way.
Oh, okay. That's a big one. So we'll be looking at the numbers and what the country Kenya is actually doing about this. Later in the show, we'll also be looking at America and this whole story of blacks dying in America. What's that story? Yeah,
it is a big deal. The percentage of deaths in the United States, more have been recorded amongst the African American population. There have been many conspiracy theories that popped out of it, but it's now being clearly linked to pre-existing conditions, whereby poor eating habits and lifestyle over a long period of time now contributed to a more rapid death when now COVID had been contracted. So eating habits, things like diabetes 2, cardiovascular issues, respiratory issues, and these have been linked to lifestyle diseases. And because of that, COVID comes in and opportunistic infections take place. And lives have been lost. Yeah.
All right. So we'll talk to a doctor in America, in Georgia, this morning. Keep it right here for that.
One of the states greatly affected, actually.
Yeah, one of the states that's been heavily hit by this. Siti Muga.
Yes.
Start us off. Today's proverb.
Today's proverb is an interesting one because it comes from Nigeria.
Many interesting things come out of Nigeria, don't you think?
I agree, my dear. We are talking to one such interesting thing that came from Nigeria. Thank you, my dear. Delighted, yes.
You walked right into that one.
I did.
You opened the door, my dear. You opened the door.
It is sweet. It is sweet. It will soon make a goat choke on yam. Let me repeat it. It is sweet. It is sweet. It will soon make a goat choke on yam.
Not even the Nigerian.
Overindulgence. It is nice. You keep doing it. Overindulgence. At some point, you're going to swallow it whole. It will choke you.
So it's about the goat eating the yam.
Yes, the yam, as it eats it, it's getting tasty and tasty. Instead of chewing it, it figures, why don't I just swallow it? And you swallow it whole, chokes the hell out of you.
Okay, so there's nothing about pounding. Nothing about pounding the yam.
No.
Not in this case.
No. Overindulgence.
Okay.
Yes.
So let's take a look at the headlines. We stand with Kenya. That's the headline in every newspaper this morning. That is the headline. We stand with Kenya. Page 1 comment. It's basically an editorial comment on all the front pages this morning. Kenya faces the biggest fight in its post-independence existence. Lives of its citizens are on the line. Its economy is threatened. Its culture, the way of life, is imperiled. The novel coronavirus threatens to kill us, damage our health, destroy our economy, and the very fabric of our families. It will rain pain and suffering upon our unprotected heads in the coming days, weeks, and months. However, nothing shapes and brings out character than diversity and suffering. great generals, let me move on to this one that has, great generals do not distinguish themselves in peacetime. The iron in their backbone shines through the smoke, mud, and cacophony of the battlefield. The battle for our lives today. Let me move to page 6 and continue with that editorial. The battle for our lives today will not be won by a powerful, privileged few. Every man, woman, and child must become that great general, and our weapons are not necessarily guns and bullets. Our weapons are social discipline, sacrifice, and caring for the welfare and safety of those around you. Basically, what the Editors Guild have decided to do in the Media Owners Association is rally Kenyans to fight this enemy. The enemy is not the government. The issue of you don't trust the government, the mistrust for the government, keep it aside for a moment. Things that you're feeling that are not going right, keep them aside for a moment. Can we all, first of all, deal with this one enemy? Then we shall come and squabble amongst ourselves.
It needed to happen, I think. Needed to get to the point whereby you say, you know what, all these tools that we're using for criticism and etc., we need to down them at this point and say, look, guys, we need to be on the same side of the fence with this one, and we need to be able to now forge ahead in terms of now fighting this thing. It needed to happen at some point to say, you know, if we don't, we're going to be in bigger problems otherwise.
Yep, the enemy is here. The missiles have been fired. They're coming, right?
The missiles are actually with us. I would like to prefer an additional perspective on this matter. As we've been talking about the underbelly of our economy, our governance, our government, our leaders, and ourselves, there is the reality, the one reality, and everything that you keep seeing, no matter how you twist it and turn it, what we have been is actually what we are being shown. It's actually just clearer, and we've been pretending it isn't so, but the COVID-19 is removing pretenses. All the cobwebs that we've had and we've created to enable us to see our world in a more acceptable light are being pushed away forcibly by coronavirus. And we are being forced to understand that this COVID-19, because it threatens our lives, we're being forced to understand that very stark reality. But it isn't something that wasn't there before. The state of the economy that we speak of was already terrible before COVID-19.
Yes.
The number of people who are in poor in the country didn't get to 14 million and counting with COVID-19. It didn't. It was there before. We spoke about this last year. We speak about the people who stand to suffer from famine simply because of the drought, and then we added the locust invasion. These things were there, but they were brushed aside. Now, there's no brushing it aside. There's no brushing it aside.
None at all.
Yes. So that reality that we avoided looking at is now with us. And we have no choice but to look at it squarely in the face and to say this is what we are. But the beautiful thing is this. It's forcing us to regain a humanity that we lost. Right across the board.
Yes.
You look and you realize that this one, it isn't us against each other. It is us against this
thing.
Common enemy. Yes.
And this is what we must fight. We must fight together. If we don't fight together,
we are gone.
We are gone.
We're done for.
Together.
If we fight together, then we shall defeat this
We're
thing.
done for.
Let's do that. Let's come together. Let's fight. Let's call on our generals. We must also, of course, keep reminding our generals of what they're supposed to do, and our captains and whoever. We, the foot soldiers, are ready to go to battle.
The foot soldier is always ready to go to battle. If you look at the energy that we spend in circumventing the law, okay?
Okay. 17 minutes after 6 o'clock. This is A Situation with Kenya's biggest conversation. Remember, you can download the Standard e-paper app from Google Play Store and Apple App Store. Wherever you are in the world, you get to access the Standard newspaper. You can get to pay for your subscription either weekly, monthly, or annually. And you'll have the Standard as soon as it's published. Good morning. Let's take a look at the weather.
.24/7 around the world, non-stop. This is Spice FM. Classic soul, R&B, smooth jazz, neo soul, and nostalgic ballads.
Make some noise. Yeah!
You're listening to Spice FM.
All right, fog quite low in several parts of the city of Nairobi today. Taking a look at specific temperatures. Starting off in Nairobi at 17 degrees, very, very low. Chances of showers quite high in the afternoon, highs of 24 and lows of 16. Nakuru is at 14 degrees and clear skies as it was predicted for this morning. In the afternoon, there will be rainy with highs of 26 and lows of 14. Eldoret is clear skies all through today. Partly cloudy conditions will follow later with highs of 27 and lows of 13. Looking into Kisumu this morning at 19 degrees, clear skies, chance of rain later on with highs of 31 and lows of 19. Mombasa at 27 degrees is partly cloudy. Showers expected with highs of 32 and lows of 26 for the better part of the day. It's partly cloudy in Malindi at 28 degrees. Showers expected as well with highs of 32 and lows of 27. Into East Africa now, in Kampala, it's clear skies at 22 degrees. Chance of rain quite in the afternoon, 27 the high and lows of 21. Dar es Salaam at 25 degrees is mostly cloudy. Thunderstorms predicted for the afternoon, 32 the high and lows of 24. Johannesburg is cloudy at 13 degrees this morning, opening up into partly cloudy conditions later with highs of 19 and lows of 11. Lagos this morning is at 28 degrees and clear skies as well. Showers predicted for the afternoon, highs of 33 and lows of 26. On into the US in New York, and it's clear skies at 10 degrees. Warm day today, highs of 18 and lows of 9. Paris at 13 degrees is clear skies as well, partly cloudy conditions forecasted for the afternoon, highs of 26 and lows of 11. And finally in London at 11 degrees, it's clear as well, highs of 22 and lows of 9.
Chilled Spice. Mature, intelligent talk every morning. Spice up yourself.
23 minutes after 7 o'clock. This is the situation. It's Kenya's biggest conversation. Remember, you can watch us on our live stream, www.spicefm.co.ke. Also on Facebook, Twitter, and YouTube, SpiceFMKE. Join the conversation on Instagram. Our handle on Instagram is SpiceFMKE. Taking a look at the newspaper headlines. The Standard has dedicated a number of pages to the COVID-19 story. Pages 2, 3, 4, 5, 6, 8, 9, 10, 11, 12, 22, 34, 39, and 40. All this is various stories regarding COVID-19, how we can fight it. One of the stories is on page 2, written by Dr. Mercy Korir and Daniel Osangula, and it says, "Stand up, your country needs you. We must heed or die, and do this without breaking the precious bonds that hold us together. we must maintain social interactions as much as possible. So it doesn't mean that you stop talking to one another, but you just use other means of talking to one another and interacting with one another.
If you want to understand the depth of the entrenchment of certain traits that we've had in this country, it's now. Because we're being asked, for instance, to shed certain traits, but it means unlearning them. Okay. Now, all you're seeing is this toing and froing, is that process. It's actually taking place. It's like a movie. You can actually watch it taking place. The government says this, the people listen, they do this. If you record them, they will tell you what they're thinking. By the time people actually breaking the law and going against these barriers that we've put on the day to let people, to keep people in certain places, not only do they cross and disobey the order, but they even take videos and they post them on Facebook with their faces on it. So, again, well, pun intended.
Yeah, right.
You actually see this process. And if you are to learn, forget the words. Just watch what people are doing. Okay? Now, we also need to talk about capacity that this country has had. I was having an interesting conversation yesterday with a very patriotic Kenyan. And we got talking about the capacity that Kenyans had. And I said, are you aware of the capacity, not Kemri has now, but has had for testing COVID-19 through the PCR? Now, it came to their notice that Kemri was developing rapid tests. I said, did you also know that Kemri has a production capacity? And they went, what? I said, they do. I said, are you aware that these PCR machines didn't come into Kenya because of COVID? They've always been there, even during the days of HIV. He said, really? I said, yes. I said, and that is Kemri. I said, they are the institutions who have the same capacity. Now, we, again, in this very same studio, have harped and talked about it time and again until we're deep purple in our faces.
You don't like blue? No.
Well, blue is a bit difficult. Blue is light.
Okay.
Given our complexion, you need to talk about something which is darker than blue. Yes, exactly. We've spoken about just the internal capacity that Kenya has, beginning with the human resource. And we've talked about it, and we've said, by the time remittances, meaning monies that come from abroad, are being sent to Kenya, and they are our biggest foreign exchange earner, it tells you the human resource out of this country is large. In short, we've exported manpower. Okay? But it's not just that. If you look at Kari, we talk about famines, we talk about problems. If you only harness what they already have to ensure that we have food security, if you're talking about Kavi, the work that we've been doing to try and find vaccinations in this country, not another country. And this thing has been going on for well over a decade.
Yeah.
If you look at, what is that combination of the local ILRI and Kalro? Yes. That capacity didn't start yesterday. We've always had it. Now, if it's hospitals, you're talking about the infrastructure. We do have a lot of infrastructure. It's just that it's not well managed, to put it as simply as we can. If the focus is on simply harnessing what we have, we'll be in a very, very good position to actually fight back very strongly. We have the research capacity. We have the testing capacity. We have these capacities. We've always had them.
We have.
Yes.
And at the community level,
yes,
we have this social capacity.
We do.
Our harambe, our coming together, it's our biggest strength.
We've always had it.
Unlike in the West, where people are usually distant with one another.
No, they're very individualistic, yes.
Here, one person is everybody. I am you, you are me.
Just look at the way...
We can use that to fight this thing, and we will really defeat it.
You only need to, if you ever go to the rural areas, you only need to look at how people come together for functions.
Yes.
To understand it, let's talk about a funeral. And look at how people simply throng. Nobody even asks them, but they know
You're
what
not
to
called,
do.
Yes.
People come, they volunteer, they do the other, they do the other. There are those who say, we'll dig the grave. There are those who say, they will do this.
Cooking is very clear. So
it's clear. So and so.
Cooking,
they even know. So and so is organized, and then you people, done. By the time external help is coming, they were long organized.
Yep.
Now, the point is, Eric, thank you for that. And what about personnel, trained personnel in the medical field, in the social field, who have since retired?
Yep.
They're in the rural areas. This capacity is everywhere.
It's all over.
It's all over.
It's all over.
It's just whittled. It's not taken advantage of.
It's not harnessed.
No. The capacities we had, remember we've talked on this very same show about what you call extension workers. Now, if that hadn't been left to just die, Many of the things we're talking about, these are the people who used to go around and educate people.
Yep.
Household to household to household. The structure was already there.
It's there.
But then we have what you call community health workers. This again was sort of like let to sort of like survive on its own, like an abandoned orphan child.
Yeah, it's interesting you say that, because then there were people who were not necessarily tasked by government, but went around teaching things like to prevent things like diarrhea in homes. And you had people who would teach, young mothers how to take care of a child, teach them how to wash, how to clean, teach them what to do in terms of basic hygiene.
They did.
And it was countrywide.
And they followed up, they took data.
They followed up.
And they
That's the
lived
thing.
in the community.
Yeah, so people
And it
respected
wasn't
them
one
as then
person.
yeah, people respected them as an authority when it came to now giving that.
They were listened
information.
to.
They were listened to. So you can imagine if such a thing still happened in this day and age, where you needed this message to ring through to people
If it
about the
was
things that we're
vibrant.
talking about in terms of COVID. You can imagine now what that would have been able to do.
It would be
Yesterday
interesting
we were
to
talking
see.
about the fact that people have not latched on to this thing.
Yep.
People don't understand. So you can imagine if at that point you had this network or this system spreading
The community
this
health
message.
workers had been sensitized, and they went out and started,
And they're trained. Yes.
they just need to go out and start
And do
talking
what
to
they're
people.
supposed to do.
This
And-
information would have gone very much further.
Very quickly.
And,
Very
and then
quickly.
you're telling people, okay, so guys, wash your hands. So this person who is already known, is a person who's in charge of health in our
Yes.
village, comes and tells us, wash your hands.
You're gonna
make sure
listen.
that you listen.
Even
You'll
if you
start
don't get the
following it.
details of this thing to the letter,
Yep.
but at least they've told you, number one, there's this virus that would potentially kill us, guys. Number two, there's certain things I need you to do to prevent yourself from getting it.
Yep.
That's all.
Yep.
Remember
all.
that even when, again, I have to go back to HIV, what you do, the so-called local birth attendants, these local OBGYNs, okay? Any local talent that was accepted and valued by the community were also used. And these are the same people who would be used telling mothers it is okay to give birth at home, but it would be better if you went to a healthcare facility.
Yeah.
Not you, them. Because they are trusted. You'll find there are 5 children in that family. They're the ones who've been the attendants. They're the ones who've actually ensured that those 5 children were born successfully.
Yes.
So now you come with your modern ways. It is useful. Talk to this person who understands and who is trusted. The capacity exists. It doesn't have to be imported. It already exists.
It's already there.
Yes.
It's already
And
there.
all these people we talk about being retired, Eric, they are still the same people go to in the villages say, Nani, wajua so and so.
Yeah.
As far as they're calling daktari.
Yeah,
everybody-
daktari.
Yes. And they still provide the service in the communities.
They're there. They're very much active.
Yes.
This provides a very, very good opportunity for us. In fact, a very easy way of expanding our universal health coverage program.
It does.
It will be very interesting to see how the counties that are piloting UHC will handle this, because they'd already reactivated the community health workers. They had already started working on their local health dispensaries and all. It'll be interesting to see how they handle this and how different those ones that are active.
It would be interesting to look at the one county that had piloted without and not being part of the pilot teams, and how they ensured that they have a system that actually works along the lines that UHC is supposed to be set.
Makueni.
Yes.
29 minutes to 7 o'clock. This is the situation of Kenya's biggest conversation. Let's take a look at traffic. Good morning.
This morning in Nairobi, Outer Ring Road is extremely busy for some reason. Don't know where folks are going, but yes, I understand that tomorrow then is Good Friday, public holiday. Maybe people aren't trying to get their business done before. I don't know, but that seems to be quite crazy this morning. We'll see how it opens up in just a bit. Mombasa Road is clear all the way into the CBD, as is Ngong Road and Langata Road. Shouldn't have any problems there. Super Highway has never seen such little traffic in its existence. And this means that getting from as far as Roy Sambo into the CBD will be very, very easy today. Operations at the ferry stopped as of yesterday. Let's see what that looks like today and share information about how you'll be able to cross from the island to the mainland and vice versa. All right, Spice FMK is how you can reach us on Twitter. Give us a call on 0719 012 600. Let's know what you see. Remembering that the fog is quite low in several parts of the city, so you want to be careful, and that's Nairobi. Everywhere else in the country seems to be A-okay.
Everything nice. All right. Okay.
Spice up your life.
What do you have, Ndu?
All right.
Mature.
It's interesting because two things here. In the nation, the Treasury walks a tightrope to plug the 172 billion budget hole caused by the coronavirus. We're getting around to budget time in a couple of months in terms of what will be done for the country. National Treasury Cabinet Secretary Ukur Yatani is walking a tightrope as he looks for 172 billion shillings to plug the hole created by President Uhuru's COVID-19 stimulus package, while the top priority for Treasury technocrats is to cut as much as possible in the travel and hospitality budgets. Yatani said that the ministry will not hesitate to also shave off part of the development budget. I quote, "We are revising the budget and nothing will be spared, even development. We are suspending some projects, finally, to address the current situation and recovery of income." Though the 172 billion shillings cash shortage figure is still preliminary, Yatani said the situation was expected to get worse and Kenyans should tighten their belts some more. However, in another report, ignore media reports. There is enough food for everyone. The government has assured Kenyans.
We're being alarmist, right?
That there is enough food. There are enough food stocks to feed the hungry as the country battles COVID-19. The reassurance comes a day after a section of the media reported that that government silos were empty. This is coming off
the
the
evidence the government is providing to back up what.
I don't understand. No, Wakesa told us 3 weeks ago that there's nothing in terms of reserve.
Government.
Yes, he told us. It was him who said.
Either they were saying that so
Now-
that they can open the doors for importation
But that's
and
what
trade,
I'm not.
or there was actually no food.
But
It could be two scenarios.
The Ministry of Agriculture, Livestock and Fisheries and Cooperatives and the Council of Governors released an update on the National Food Balance Sheet showing projected stocks up to June 30th. It's not possible for us to have June 31st, okay? But let's say June 30th. In a statement, the ministry said staple foods such as rice, beans, pulses, wheat, bananas and others are sufficient across value chains.
Sufficient until when?
Until the 30th of June 2020. The ministry said there is an estimated surplus of 3,450,90 bags of maize. I'm sorry, but it's just confusing because yesterday's report showed us that Peter Munya said, he quoted that the reason why he's not able to buy and the reason why he then had to import was because there's not enough in the country to take us until a certain point in time. Now they're saying there is food. So which is it? Is there no food or is there food?
Or they
It
misquoted.
becomes very confusing now. Or they were misquoted. All of these people were misquoted.
Do we need to go back to past examples?
Good
that we've
grief.
seen?
So they're saying that in addition to the maize, so they're expecting a surplus of 3.4 million bags of maize by the end of June, right? In addition to that, other types of food such as beans, we have 2.5 million bags of beans, 737,000 bags of wheat, 411,000 bags of rice, sorghum 455,000 bags, millet 63,000 bags, green grams, milk, we have 4.3 million liters of milk, UHT 1.4 million liters and kilograms of milk powder, right? So they're saying this information follows revelations by the SFR, the Strategic Food Reserve, that the country has no single bag of maize in its stores, even with the possibility of a countrywide lockdown. So when SFR is saying we have no single bag of maize, how can you be in operation anyway without a single bag?
First of all, and then the rationale behind the import of maize was that we don't have enough. The rationale then for not buying from local farmers was that we can buy, but it's not going to sustain us. Then in the same breath, mind you, in this same report,
Don't worry,
the government is also calling on the private sector to buy maize from farmers to ensure a continuous flow within the country.
Good stuff.
So, okay. Before it was, we can't do this because it's not going to sustain us. So
Okay.
Somebody is trying to do business here,
Yeah,
and
it's
they're
clear.
throwing in confusion.
Why don't we hear from the farmers if their maize has been bought?
Hmm.
Just let's start with that. And they say all the maize that we're talking about has now
been
been
mopped
mopped
up
up.
You
by
had
the
all this, and
government
they've
or
actually
by
bought
been
it
mopped
through.
up.
sector.
Yeah.
And we will say, okay, it's been mopped up. Then we talk about shortages. You know, if there is one situation where chickens are coming home to roost, again, the
It's this
underbelly,
one.
Another
it's
one.
now.
This one.
Yes.
This one.
This back and forth we've had about food security, you see, now there's no running away from it. We have a problem, and this confusion that you're speaking about, unfortunately, the way we're going to interpret it without any facts is that these people are at their games again.
Yeah.
Now, it's an uphill task for the government to prove that these aren't games, this is true.
Yeah.
They've cried wolf so often that right now, even if they're going to be telling the truth, even if it is true, people are less likely to believe it.
No.
And they're more likely to ask, you say, okay, we've heard what you're saying, where's the evidence?
This is the thing, and in this rallying call to stand as Kenyans with Kenya, you know, to stand as constituents of a country, all of you together, you want to tell the situation as it is. This back and forth of cartels and
It
no
appears
cartels,
like this.
say it as it is.
This update came from the Ministry of Agriculture. It's quoting the technocrats in there. They know that there is enough food. The politicians at the top, politician Noah Wekesa, the politician Peter Munya, those ones are the ones that we should not believe. When they keep telling us things back and forth, they're just looking at, all right, so where can we import?
This is the thing, and so you want to import food.
jokes.
You want to import food, and you have it here in the country. You want to import food, and there are farmers here who could benefit from that.
And people
you
are
want
growing.
to import food, and there's a surplus in the country. It's been raining. There's been a glut. All kinds of things going on.
If you read further, the information in the standards, the government is again calling on farmers to keep producing because
That's what I'm
the rainy
saying.
season is with us. And
Yep.
you're thinking,
And in another breath, you had said we can't buy from you because you know what you have is not sufficient.
you see, this is action that the government could have taken earlier, and we would have been confident that the government is supporting farmers to keep producing for our food security. This effort we haven't seen. The efforts that were set up to ensure that this food security is actually in place, we have seen how that was scuttled with the irrigation scheme in the Tana, didn't we? So again, what the government is saying may be true, but we have to ask for evidence here.
Yep.
Because this is something we've heard before, and believing it has been belief that has resulted disastrously.
Serious. Now, let's go to the counties. I've got stories from 3 counties. One is Murang'a. Murang'a Governor Mwangi wa Iria has said that the county will produce 300,000 masks to be distributed to residents to help contain the spread of COVID-19. Yesterday, the governor donated 10,000 face masks to border riders through their representative. All right, so 10,000 face masks were given to border riders by the county government of Murang'a. That's what they're doing. In Nairobi, the county government plans to begin aerial fumigation of the city against the coronavirus. The health department has announced plans to deploy drones to fumigate the capital, a method which is faster and covers more ground over a short period of time while employing minimal human resource. CEC for Health, Hitan Majevdia, yesterday told the Standard that City Hall has made a request to the Ministry of Health for procurement of drones to be used in the fumigation. We are currently at the procurement stage of the drones, and I have engaged my superiors at the Ministry of Health. It's a process, but it's the best and the fastest way to fumigate the city. This will drastically reduce the spread of COVID-19. So we don't have the drones here. We are actually now
We're still trying to buy them.
trying to buy them. In Nyandarua, the governor has issued Executive Order number 4 of 2020, which is giving some relief for citizens. One of the reliefs is ordering for that people who are owed by the county to the tune of 200 million shillings be immediately paid. Traders who have had their payments for licenses extended from March 31st to May 1st, and those who operate in the open air markets have been given a waiver of operating without paying anything until June this year. The governor also announced that he and his deputy had taken a 30% pay cut. CEC is 20%, while chief officers and those in job group S will take a 15% pay cut. The money will go towards an emergency response fund, which will be set up to assist those affected by the pandemic, either directly or indirectly. What the governors are doing. We'll be talking to the governor of Kwale later on in this show, Salim Mvurya, to hear what the county of Kwale is doing. County number 002, it has gone into isolation now for containment measures. This went into effect last night.
Okay, Mandera is in a desperate race to find COVID-19 pair contacts. A team of health officials has been dispatched to trace people who may have come into contact with the two individuals who tested positive for the coronavirus in Mandera County. The two, a man and a woman, are in isolation at the Mandera Referral Hospital. They arrived in Mandera on the 1st of April, having travelled by bus from Nairobi the previous day. Mandera Governor Ali Roba said the two landed in Kilifi from Europe before proceeding to Mandera. Health authorities are exploring the possibility that the two may have contracted the virus while in Kilifi. So now we see Dr. Mercy Korir talks constantly about the importance of contact tracing, because what it does then, it helps you curb, because you can quickly find who, when, where, and go with that information. So now we have running after ourselves now to find out, where did these two, whom did they come in contact with, and where were they over a particular point in time.
The sad part here I'm seeing is you cannot reveal the identity of the person who has tested positive.
No,
And
you
remember,
can't.
we asked this question
Right?
yesterday, and we talked
And
about
because of
medical
that,
ethics.
because with that
It's
you
a
could have
long
said,
while ago.
with that you could have said, City Muga has tested positive. If you have come into contact with City, please present yourself.
This is the thing.
Easy.
This is why
But
it
you
would
can't
be
do that.
important to reveal. But now, with ethics and things, now you're
it's not
unable
just
to.
ethics. This is where counseling comes in.
Yeah.
Because when you sort of like self-identify and you understand the need for you to do so,
Yeah.
especially if you know that you have actually been tested negative after being tested positive, one, it messages three ways. One, you were tested, so testing works. You are positive, it's been talked about. You are now negative, and you're telling people, I am the one,
Yep.
and my tests can show these things. That was the powerful message. But then you see, this requires counseling.
It
So that
does.
somebody understands that the stigma that you may be feeling towards this need not arise. The positive aspect of
You're
this
helping
far
others.
outweighs anything that you may think of.
Absolutely. And we heard this resonate with Makweni Senator Mutula Kilonzo Jr. yesterday. And he said, look, I took the test. Fellow senators and other members of parliament took the test. I know for a fact that I am negative. He also said Senator James Orengo also took the test and he's negative. And he talked about the fact that it is very important for you to then make your status known. Not because anybody wants to stigmatize,
Yeah.
but because people
You're
want
helping
to
one
know who may have come in contact with you. And he sent out an appeal to his fellow members, and he said, you know what, guys?
If you've tested
you
positive,
guys,
just
if
say.
you've tested positive, say, because you're interacting with thousands of people on a daily basis. We don't know where you were. We can't be sure that you stayed at home. So tell us so that we know how to start tracing.
Within a very short time, it will not be difficult to hide this thing. We will
Oh,
not
yeah.
be able to hide. When you have people getting into those secondary schools, into the dormitories, they'll be picked up they'll be falling sick in your neighborhood. You'll be taking them to the isolation facilities.
This thing could...
It will not be hidden.
Erica has a point. You know, you could make this thing normal. Why is it that we don't fear to go to hospital if you have a fever because you think
Yeah.
it's malaria? It needs to be understood. It's just a disease like any other. It's just that it has disastrous consequences within a very short time.
If not arrested.
By the way,
early,
malaria
yeah.
also kills people equally quickly. This is
It
the thing that
does.
people don't understand. But it isn't stigmatized.
Meningitis does.
Actually, there's hardly any disease that won't kill you. Okay? Now, this is a focus. Again, this is where the plug into the HIV system comes in. There are people who are trained in counseling. There are people who understand. They exist. If you don't destigmatize this thing, so people keep hiding it, this one is worse than HIV in
It
terms of how
really-
it spreads.
yeah.
Okay? Many people who need not be infected will be infected.
I think it's necessary to reiterate that point, CT, is because people have said, if we're saying it's just a common cold and a flu, then why are we making so much noise
It's
about
not
it?
a common cold and a
The
flu.
thing, though, in this case is that the rate at which COVID-19 spreads is the alarming thing here. And
Yep.
that's what we're trying to do. When we talk about flattening the curve, it sounds like really pretty English and all of this. But essentially what you're trying to do is stop so many people from being infected at such a rapid rate.
And
That's
stop
what
hiding.
it means, essentially.
Because
so
once you
once you
feel-
hide it, you're making it worse.
And you're putting yourself at a higher risk of going to need the critical care.
Exactly.
95% of people are healing.
And we
or are
know
not
that
dying.
we can't handle it as a system, healthcare system in this country when it comes to critical care. They've told you, this is interesting enough, because also the Ministry of Health has told you, we cannot handle it
We will
if we
not be
get to
able
the
to
point
handle it.
where we
Yeah.
have thousands of people in need of critical care.
We will
So
not.
what are we trying to do now? Make sure that we know who is affected now so that we can handle it when it's at its beginning
trace their
stages.
contact.
The ministry should unlock the capacity that we have in this country and utilize it fully, because it can be unlocked and it can be utilized and it can be an all-out effort in the entire country to ensure counseling services are provided. The need to sort of like declare your status is all these things can be done.
Let's
You know,
take a short break
yeah.
and come back out of it. 12 minutes to 7 o'clock. This is the situation with Kenya's biggest conversation.
Sugar and spice and everything nice, everything nice. Ice FM.
Mature, intelligent talk every morning. Spice up yourself.
Right to your doorstep. We're going to be giving you a short link called Beautiful wherever you are, and or organize and arrange for the Standard newspaper to be delivered right to your doorstep. So we're talking about the stigmatization of this thing. You've seen a video that's gone viral of CID officers who have done the contact tracing, and they have identified somebody who has come into contact apparently with somebody who has tested positive for COVID-19. And when these people went to call out this lady, I think the mother or a close relative was out there saying, no, you can't just come and pick somebody like that. We need to identify yourselves. And they're saying, we're from the DCI. Yeah, but why are you taking? So there was a huge back and forth, a scuffle, so to speak. And crowds gathered and people started saying, no, come on, all right, so what is it? If you are suspected of COVID, just enter the car and go get tested and go to isolation. So there was a huge back and forth. Number one of the things that emerged out of that video is there are 3 or 4 CID officers, plainclothes officers. Remember the warning that had been issued by the police that there are people who are coming and claiming that they are contact tracing,
Right.
Yes.
and yet they are criminals. So these are 3 or 4 plainclothes officers saying we are from the DCI.
Evidence?
And then they produce just this badge. You know the way the cops usually just flash that. From
Yeah,
DCI, look,
yeah.
and then they take it back in. Nothing else. They don't even allow you to touch that thing. And they say we're from DCI and we are here to take the lady because she we've been doing contact tracing. Of course, the family is like, no, what do you mean? You can't just come like that. My beef with that is why not use health workers, public health officers, to be the ones who are contacting this person and let the police just provide the backup.
Yeah, because you can be sure that the manner in which they would approach the situation would be
different.
1,000% different.
And then they're properly geared and saying, look, this is the issue, so we are tracing you because you came into contact with so-and-so, or with somebody who was tested positive. We'd like to go with you so we can test you.
Right. What do you think
If
it
you're
does to
negative.
you when a cop shows up at your house and wants to bundle you
Toka.
away? What does it mean? You're
COVID.
being arrested.
Yeah.
And what do you think it sends as a message to those in your
I'm a criminal.
vicinity?
That you're
This
gonna
person
COVID.
has done something wrong. So you can imagine anybody else who presents with symptoms, ain't no way I'm telling anybody, because what will happen? You will come and arrest me too.
CIDs come like that.
This is the problem. Yeah.
If they come even properly kitted and they said, all right, so this is where we are from this, we have done this and that.
Eric, do you know if you know there's one person there and there's the likelihood of contamination, why don't you just tell them we are coming to test in this particular area?
Yeah.
And the test will not take long. All right? So in the process, that's what you do. It can't be that you're targeting. So if it happens that you even know who you want to target.
Yep.
But again, people get tested and say, oh, it is simple. I was tested, I was negative. Now this rapid test comes in handy.
Yeah.
So people feel I'm not being targeted. Now, police are the worst group of people to use when you are dealing with health
CID
issues.
officers.
Why would
Worst.
because you're the intonation.
You're sending the wrong message.
yeah, the
burly
message is
people.
that
They're
there's a
huge
criminal
people.
activity that has occurred here. Come on.
Look,
Wrong.
they can accompany the health workers.
Yep.
But they can't be the ones who are
They
doing
cannot
this.
be the
They
ones
can't
who...
be the one passing the message. They cannot be the ones asking you to come.
No, it's not them.
No.
They can't be that. You see, they have their role and we understand their role. But they are health workers who are trained to do such things. They even know how to communicate this message.
Yep.
They know that's what they do.
People have been trained. Even Red Cross people, volunteers, have also gone through use Red Cross network.
Eric, in those very areas they were going to, I am sure their clinics, their health workers,
Yes,
their community health
local.
workers who work there, I am sure.
There are local health workers.
Why don't you use that network of local health workers, whether they're community health workers, whether they're clinical health workers, because they would have done the same thing.
It's a government treating people the same way it does treat people all the time. Like you're criminals, like you've done something
Something
wrong.
wrong.
Like, it's the same.
This is the thing, and I'm saying if that's a message that's being spread, everybody in that vicinity, because you can be sure crowds gathered, what happened here? Everybody else who felt, so now this COVID thing is actually a criminal thing.
But they don't isolate.
I've done something wrong.
And then
That's why they're coming to pick
they
me up.
come and grab you and
Yeah.
throw you into the back of that.
You
In
would never
fact,
think that it's because they're actually wanting to care for you.
The
you
other
know.
group of people who need to be counseled are our security people.
Yes.
They need to be counseled and they need to be taught how to handle civilians in such a... You don't want to exacerbate the enmity that already exists. You want to reduce it. You want to be seen as part of the solution, not the problem.
Yes. And importantly, also how to protect themselves.
Yes.
One of these officers goes ahead and removes their mask so they can shout back at this lady.
Oh, that's it.
So the mask is off, and then they grab the lady and they're shouting at one another, pushing them into the car.
How does that help?
So ideally, that this year, all those people should have gone into isolation,
Yeah.
including the cops,
Including the cops.
and that car disinfected in case.
Do you know
Yes, but-
that the policemen are in the line of fire as much as the health workers?
Directly.
And they need protection, as the health workers do. But they also need to be trained. This isn't police work as usual.
No, it's not.
They have to be trained and have to be told, guys, this one you have to handle differently. This one you have to use this approach. Okay? And if it's a health issue, the numbers of people who are trained in health matters should take the fore. They should be there to provide security.
We had the census last year. Did the cops come and knock at your door?
No.
It's a census official who comes and knocks, but they also, you can see the cop who's accompanying.
Did we have an issue with those things?
No.
No. Did those census people enter houses? Yes.
Yes.
And they sat, and there was, in some houses they were given meals.
Yes.
Did the cops open their mouths?
No. Did they not do their duty? Yes, they did.
Cops are the ones who've done the contact tracing, I'm imagining in this particular case. So the DCI has been given, so these are the people who came into contact, look at the triangulation of phone numbers, identify and follow, track and trace. So when they're doing that, the DCI track, trace, this is a knock at your door. Toka.
No, they need to hand over that information once they found it.
Once they get- no,
Once they get that
isolation.
information, they need to hand it over then to the people who have been trained to have these
I
conversations.
can get this process. You already know the health facilities, health workers, blah, 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 in that
You
area.
have the
The
network.
government has those numbers.
Yes.
They know those people. So you know when we come to this area, you've contacted those people and said this is what we're going
We are
to
going
do
together.
and we're going here. All this fuss that we've seen would not be there.
Come, I keep asking myself, as we sit like this, three of us, it was
Come. Okay.
we're able to figure this thing out. It's very simple. Why is it then not easier? Why is it then not easy for those at those levels, in those agencies, at that level, security, etc., to understand this thing?
Let me ask you something, in response to your question. Before Mr. Mutahi Kagwe became Minister of Health, well, he just jumped into the fire directly. He bypassed the frying pan, just jumped directly into the fire. There was a minister before him and one before that.
Yeah.
It's in his time that we are seeing him bringing in health specialists. We see him giving focus to KEMRI. KEMRI was in existence when Cicely Kariuki was there.
Yes.
What we kept hearing from her ministry at her time was political speeches from the Ministry of Health.
UHC is doing swimmingly well.
That's what we kept hearing.
Yeah.
And you're wondering, why are you not bringing in those who are trained to do this thing, to tell us how this thing is working? Why? We would read things and we're asking, okay, what have we been told
What's
here?
happening here?
Na-
We really don't know anything.
Nothing. Now, something as basic as you have a department, a section in your ministry that is actually trained, funded to do this work. You're not utilizing them. So the question is, what is your focus really then?
No, not even what is your focus.
It's attention.
What
This
are
is
you
where
doing there?
This is where I agree with Patrick Adaro when he says that colonial system, is still in perpetuating itself. That's exactly what it is. It's about lording over people, never about working with the people, never about thinking, all right, so this is the best way to approach this.
They're not
It's-
civil servants, they're civil lords.
It's
There's
lording
no
constantly.
thinking, no logical thinking, no planning, no focus comes into this at all. At all.
Remember,
yes.
I was telling you earlier on how there's this, what was reported. Why don't we say this after the hour?
Yeah, we're coming to the top of the hour. So as we go to the top of the hour, CT, today being Thursday, the 9th of April, 2000. Today is what it's called? What? Or Monday, Thursday?
Oh, good Lord. Okay, let me just help you after the break and tell you what Monday, Thursday
Or Monday,
is.
Thursday. All right, CT Muga, today's proverb.
It is sweet. It is sweet. It will soon make a goat choke on yam.
It is sweet.
Oh, it is.
It is sweet.
But it will
It will
soon make a goat choke on yam. Overindulgence.
Okay. It's 7 a.m. This is the Situation Room, Kenya's biggest conversation. Good morning.
Sugar and spice.
All right, Kangunde Road and Jogo Road looking quite clear today. Probably see a little bit of issues right around the industrial area, then we'll spill over to Jogo Road, but that will be fine then getting into the city centre. Wayakiwe has been given we're giving you the all clear that we don't have any issues there at all. All right, the fog seems to have cleared, so you can go about your business as normal. Still be careful. The roads are really clear, so you want to avoid things like over speeding. We'll let you know if anything else is happening in different pockets of the city and around the country, but for now it does look really, really good. From Kisumu to Eldoret, from Nairobi to Mombasa, everything looks good around the country. Spice FM KE is how you can reach us on Twitter. Let us know what you see.
This is the Situation Room, the home of hard-hitting political commentary and penetrating insights about the state of the nation. This is a talk radio experience like no other. The Situation Room, a place for hard truths, debates, and elevated conversations. The Situation Room, witty, political, engaging, deep, controversial. In the room, we have C.T. Muga, researcher, academic, seasoned political observer, a fountain of wisdom in these politically uncertain times. Ndu Oko, Nigerian by birth, Kenyan by choice, communications expert, Pan-Africanist, a truth seeker and believer in people power, and Eric Latin, agent provocateur, the man in the chair, seasoned journalist, news hound, a man who believes in punching up,
Nairobi,
not down.
94.4, Mombasa,
This is the
7.9,
Situation Room,
102.5,
the
Kisumu,
only way
Nakuru,
to start
96.0,
your day.
96.7 in Eldoret, 90.9 Nyeri, Malindi, 97.7. At around 7:30, we'll be crossing over to the United States to speak to a medic who's working in Georgia. And you know, the story coming out of America is that a very great number of black people have been impacted and heavily affected and dying out of COVID-19. So we want to hear from a medic there. What exactly is his story and what's happening?
There are those who say that part of the reason is pre-existing conditions, and there are those who say the hereditary health conditions that people have because of the harsh conditions and the discriminatory conditions that black people have suffered in America. But those same traits of pre-existing health conditions can also be found in Native Americans. And they are fewer in number, but if we are going to say, and if there's evidence that these pre-existing conditions are a problem to black people, they're also going to be a problem to the Native Americans.
Yeah.
Because they have also suffered, in fact, even worse discrimination worse. Remember, they had a case where the people who came into America from Europe, it was a policy of extermination, not accommodation, not integration, it was extermination.
Yeah.
And they were pushed and shoved onto some of the worst terrains you could ever think of. They have suffered the same fate, much worse than even the black Americans did. So if this is happening and if it is true, expect that the Native Americans will also have the same problems.
I'm finding it quite peculiar to talk about, lifestyle, because of people's lifestyle. Therefore, they are being predisposed to lifestyle diseases and therefore getting affected by COVID-19. It's not only this black race.
No, but look. Okay, if you want to do a little look at what happened, especially with the African Americans, majority of whom came into the U.S. as a result of the slave trade, right? And now with the food that they were eating, at that time, a lot of times they were given the fat, the remains of food, right? That's what you take, you go. They started to make this food a delicacy. And that's why you see a lot of what they call the soul food is actually going. Now, because of that, over time, they got quite a number of lifestyle diseases, especially diabetes too. And then some other cardiovascular problems like, high blood pressure and the like that then could be linked to diet. Now, we've already been told that because of what COVID does to when your immunity is low, the higher the chances of you contracting COVID. Now, this happens in a lot of cases when you do have lifestyle diseases, things like your immunity automatically drops. Now, that's what they're saying, that in this sense, enter COVID when your immunity is already low and you already have where these immunity suppressing diseases, such as diabetes, such as hypertension and high blood pressure, such as that already in existence. And in a greater percentage of the population of African Americans that you find these diseases in the United States, it is more likely that they would sooner die when they contract COVID. That's what they're seeing.
Before we had the COVID, what are the statistics of these lifestyle diseases? Did we have predominantly black people having the lifestyle disease, the cardiovascular diseases, the diabetes?
Interestingly enough, yes.
Was that the statistic all along?
Yeah, no, all along it has been that the majority of people who have been affected, for example, like diabetes 2 in the United States, you would find a greater percentage amongst the African American population. And that's what they were saying. Now, enter COVID, you'll find that because of that, we talked about these opportunistic infections that take place, or because of the fact that you have a pre-existing condition, that you're likely then to be greater affected. That is what has come about.
Hey. Because looking at those statistics, I mean, Louisiana has the fourth largest. This is in the state of Louisiana has the fourth largest number of COVID-19 cases in America, and the majority of the COVID-19 deaths are in New Orleans, where Black Americans constitute 60% of the population. 70% of COVID-19 deaths in Louisiana are African Americans. This is according to the state's governor, John L. Bell Edwards. Go to Detroit, almost 80% black. The most concentrated coronavirus cases in the state of Michigan. The death rate in the city accounts for 40% of all deaths in the state. In Chicago, 30% black. Black Americans accounting for 70% of all coronavirus cases in the city. More than half of the state's deaths.
Some of these diseases. And the way they classify it, if you look at the numbers, yes, you'd say black are a majority, but you need to understand when you say this majority, what do you mean? For instance, they call them non-Hispanic blacks. See, 49.6% of them have the age-adjusted prevalence of obesity. Well, I mention obesity because it's what now brings about many of these other complications that we speak of. Okay, among the Hispanics, it's 44.8%. So it isn't as though that the percentage is that
It's
high.
unique to the blacks.
No. Among non-Hispanic whites, it's 42.2%. They're all in
Obesity.
the 40, yes, it's in
There
the
you
40
go.
percentile. So this exaggeration that someone tells you that it's just among blacks, no, they need to explain it further.
There needs to be more information.
There has to be. Why they bring in education is they say that people with more education, one, you'll have more of a disposable income and you're likely to think more in terms of health and other things. And they say the non-education or the lack of it also leads to, well, the way people think and the way they go about their lives. All right? It's the same way. This disease is the same way that is being explained by the concentration of certain communities in their jails as opposed to others. If you look at the statistics, they will also tell you that the number of black people in the jails are actually more than the numbers of, say, whites. Hispanics will follow and then whites. But then why don't we pause, just break and say, in the population of America, 300 million plus, Okay, what is the percentage of black people in America? What is the percentage of Hispanics in America? What's the percentage of white people? So if you look at the percentage of white people, 10% of white people and 10% of black people is not the same numbers. There'll be more whites with
Yes.
their 10%.
Yes.
So when, again, it is the framing of it and the structuring of it. It is true that those numbers may be as they are. But if you look at some of the states that from whence we are getting these numbers, those are states that have a predominantly high number of blacks in them. So, of course, if you even take a random sample, there'll be more blacks in that sampling
That are
than-
dying.
Of sure, if you look at continental U.S. and you look at the southern states, you have a higher percentage of black of African Americans
In the South.
in the south.
Southern states, yes.
That's just the way it is. The numbers are higher. I do agree that the research or those who are pushing this particular agenda should have given more information. It is true that you see things like diabetes, stroke, high blood pressure prevalent.
But also,
in this-
it's also
but it's also
emerging.
important to talk about the fact that yes, the issue of education plays a huge role in all of this.
And inequalities.
And inequality,
I'm
for
seeing an
sure.
article here that's talking about critics are noting that the risks are significantly exacerbated by racial inequalities in healthcare, including facility closures and caps on public health insurance, plans like Medicaid and Medicare. African Americans are twice as likely to lack health insurance compared with their white counterparts and more likely to live in medically underserved areas where primary care is sparse or expensive.
Yeah,
So
they
it
can't
goes
afford
even
it.
beyond that, right? It goes into what are they exposed to, where do they live, what are they, what is it that they're finding themselves exposed to? If they're facing these higher risks because of where they live, because also if you're looking at the states of Louisiana, and the deaths are notably higher in Louisiana, not just of black people. The number of people who are dying in Louisiana out of COVID-19 is high. A majority of them will obviously be blacks. It tells you that blacks are dying here.
They are dying, but also remember that one of the things that CDC has documented is that obesity can actually be linked directly to an increased type of disease like cancer, coronary artery disease, type 2 diabetes, and stroke. And if you look at the statistics that they have given of persons over the age of 80, they say that what they have is that 36.5% of US adults and 17% of children were obese. Generally speaking, without going into details, meaning obesity, 1/3 of their population has this problem. Now, if you're talking about 1/3, statistically speaking, those who are highest in numbers, believe me, will be greater they will be greater represented simply because of their numbers. Now, when you have had a problem that has existed, by the way, this obesity issue, it didn't come up with COVID-19. It's always been there. And the reason why heart diseases rank as one of the disease that kills the largest number of people in that part of the world is specifically because of some of these reasons that we've given. Now, the truth is, again, COVID-19 is simply opening wide the underbelly of problems.
It's showing very many things.
That's what it's doing.
Among them, they're talking about, so when they started testing, rapid testing, and CDC released testing kits, right?
Yes.
They went to those communities where people are likely to have traveled.
Yes.
Now, in very many black people, communities, people have not thought, well, not many people have traveled here.
No,
but
they
if
don't.
one person had entered with COVID-19 into that community, they were spreading it without being detected.
Yes.
So now cases are erupting because there are more people who went into, they got their COVID-19 without getting tested. So just because of that, because of also that discrimination, because of that imagining of, okay, so these people, because of how they've been living, they've not been exposed to travel, they do not live well, therefore they have not even been traveling. It basically just boils down into, it exposes the issues of the injustices, the inequalities that exist in communities, the education, the exposure, all of that is being just brought out to the fore.
It's very, very true. You know, this Spanish flu that we speak of, that even came to this lovely continent of ours after the First World War, it didn't just come here, it also went to America. And it killed more people than people would probably even know. But what they did then was many, not counties, not states, counties more or less blockaded themselves from others. This quarantine we're speaking of, people self-quarantined. Because they realized that if we keep to among ourselves, the likelihood of it spreading would not be there.
Yep.
But it spread despite all that. Because people, as you say, had already traveled. this isn't the first time in the history of mankind that we're facing these problems. We're just better informed, and we have a clear knowledge of what's happening almost as it happens. And that is probably why this panic that you see is also doing the same thing. It starts somewhere, it spreads just as quickly as the information is spreading.
Yeah.
But it doesn't mean that we have a situation that cannot be managed or handled if people are rational and clear about it. Now, the Chinese showed with clarity that they were not romanticizing this thing. They did not joke with it from day one. They pussyfooted first. That's why it got to
from day 60.
Yes, they pussyfooted, and then realized we were dying.
Yeah.
And then they clamped down. And when they did, 3 months down the line, they have clarity. Now, we are talking about 3 months down the line. The complete opposite of what is happening in China is like to happen because of this toing and froing and these indecisions. You know, this isn't a time for playing around. It most certainly isn't. And it's not because you want to save the common citizen, you want to save yourself. Because there's no one who's in leadership who doesn't come across or who doesn't interact with the Mwananchi.
Yep.
Everybody interact, everyone. So the likelihood of being infected is just as high for everybody.
The seriousness with which to deal with it is important.
It's actually
across the board.
Yes, and you, the person making the decision, it's actually for your safety. If you
Start
can't
from
understand
that.
start just with your safety. Forget other people. That may be a little difficult for you to figure out. It is for your own safety. That's easy enough.
We stand together today and every other day going forward. As a country, we have a common enemy. We need to fight this one common enemy. Let's fight that together. This is a situation room. It's Kenya's biggest conversation at 7:15. Keep it right here. We're taking a look at weather shortly, and the conversation continues.
All right, it's warming up a little bit in Nairobi this morning. 17 degrees, but mostly cloudy. Chances of rain quite high for the afternoon. Highs of 24 and lows of 15. Then taking a look into Nakuru today. It's sunny conditions all through at 15 degrees. However, we'll take a break in the afternoon for some showers. Highs of 26 and lows of 14. In Nyeri at 17 degrees, it's mostly cloudy. Showers expected in the afternoon with highs of 24 and lows of 16. In Eldoret, it's 14 degrees and clear skies with periodic clouds through the day, highs of 27 and lows of 13. 19 degrees and clear skies in Kisumu, showers expected in the afternoon, highs of 31 and lows of 19. In Mombasa, partly cloudy, chances of rain quite high very early in the day, highs of 32 and lows of 26. Malindi at 28 degrees is partly cloudy, will follow suit with rain as before, highs of 32 and lows of 27. Kampala is mostly sunny at 22 degrees, also following in with rain at 27 degrees the high and lows of 21. Dar es Salaam at 26 degrees will be mostly cloudy today. Thunderstorms expected though in the afternoon with highs of 32 and lows of 24. Johannesburg is cloudy this morning at 13 degrees. Partly cloudy conditions continue later with highs of 19 and lows of 11. Looking to Lagos, clear skies in Lagos at 27 degrees. And showers expected in the afternoon with highs of 33 and lows of 26.
spice up your life. Mature, intelligent talk every morning. Spice up yourself.
Speaking to Joseph Owoho, a Kenyan working in the USA to understand what's happening to black community. That's all.
Mornings done right.
Well, reports are coming out that,
94.4 Spice Up.
black people are being discriminated against,
Right.
allegedly, right? So people who have gone into quarantine facilities, they have been taken into government-facilitated quarantine, of course, where they're paying for themselves, and then a few days later, they claim that they have been evicted. Many of them are people from West Africa. I will not say Nigeria, but
Were
that's
they
where
residents of China, or were they visiting?
some of them are residents of China. Some of them are visiting. So some are claiming that they've been kicked out of their apartments as well. So in your apartment neighborhood, they claim there's some. We will get a couple of them to talk to us maybe tomorrow when
Let's
this information
clarify
develops.
this and understand what's really happening.
Yeah,
Yes.
because the government has basically denied this and said no, this nothing like this is happening. What we know is that there was some infection and some Nigerian national had tested positive, and contact tracing took it back to a restaurant where they had gone, and the owner of this restaurant plus their child had tested positive as well. So it assumed that the Nigerian national is the one who had gone there, and these people got COVID-19 also from the contact with the Nigerian national. So beyond that, now this Nigerian national was picked up for isolation. Now beyond that, a lot of information that's coming out from the people who are claiming that they're being kicked out, and from what the government is saying, from also what officials in the embassies, like the Kenyan embassy in Beijing, is saying, no, look, we have not heard those direct complaints.
Why don't we let's just gather more facts
This is it.
so that we can determine what's
This
really
is it,
happening.
yes. This has been reported in international media. We'll be speaking to some of those Kenyans who claim that this has happened to them. We'll also be trying to speak to officials from either the Chinese embassy in Nairobi or also the Kenyan embassy in Beijing.
Yes, in fact, the Chinese embassy here, the embassy would help clarify this greatly, wouldn't they?
Yes,
Yep.
they would. They would.
Difficult to comment until we have more information.
By the way, one of the things that is also happening, this was reported in the Washington Post, is that one of our counties actually has a capacity for producing 30,000 face masks.
Indeed. Kitui.
Kitwe.
Kitui, the governor of Kitui went full on, right? Immediately we realized that this is a need. With the country needs face masks. The country needs PPEs for the medics. She said, look, we've got the Technical Training Institute in Kitui, and we have got people who are there in college. We can convert them into a factory. And immediately they got that deal going on. Those people are not even leaving the facility. They are staying there. They're housed there, so they don't leave. So they're not mixing with the community. They're living. They're working. They're producing. How many again?
30,000.
A day.
That's the capacity per day. And according to this report, that one of the things that caught her attention is that she has a daughter and a son-in-law who tested COVID positive. Of course, if you're going to write a newspaper article, it is good to give it a human touch. It makes for interesting reading. But
For sure.
the truth of the matter is that we do see progress coming out of our counties.
Without talking. Did you hear it? It was what was reported by the Washington Post.
No, it had
Yes.
been there. It had been there. Now let's
No. Listen to what I'm saying.
where was it,
Just hold on.
Eric?
Hold on.
It was in the newspapers.
Hold
When?
on.
2 weeks ago, actually.
Did you see
even
any-
even on the TV news?
Did you see any shouting and on the masks written charity in Gilu government?
No, that's the thing.
So this is what
she's-
I was going to say in this
it's,
point
it's
here.
not necessarily being
Without
branded,
talking-
donated by
But
Charity
hold on,
Ngilu.
listen. Looking at capacity and development without shouting and talking about things, but actually going and getting something done.
Yeah.
Getting something done that is actually going to benefit the people of the country. Whatever the motivation was, at the end of the day, you find that something can actually be done and can be done to a point whereby somebody else sits up and takes notice, number one, and more importantly, that people are actually helped.
Let me ask the question. Remember, there was talk of EPZ. There was talk of the Fashion Council of Kenya. There was a talk of the capacity for manufacturing garments in Kenya being brought into play by the government. Have we heard anything from it? Have we heard of the capacity that they have? Have we heard of what they've been producing? It may have happened and it caught me unawares.
The CS for Trade, when she came and gave this brief and said, we have had various conversations with various sectors, one of them being the EPZs, the other one she mentioned now, the deal with the county government of Kitui, also talking about the, what's it called? The university in Nyeri. that gave us that very beautiful sweet coffee.
Dedan
Right?
Kimathi.
Dedan Kimathi University in Nyeri, they've also had that capacity, and Kimathi Institute in Nyeri. All those, now it's about the follow-up. I think one of the things that we should be getting from these briefings that we're getting on a daily basis is so far beyond telling us the numbers, beyond also telling us, oh, the government has initiated, give us a progress report. Tell us, so far, Kitui, that institute in Kitui has produced X number of face masks. That institute in EPZ has produced X number of face masks and PPEs. Those are being distributed in this and that manner. We have not had anything beyond what we had at that initial stage of Kenya Pipeline and the 1 million liters of hand sanitizer. We haven't had any more information. We should be getting this information on a regular basis from these briefings. I think that gives all the information that we need to get.
Again, the government not doing what it can with what it has. These are resources that we have. They may be working. We don't know. And then there's the Harambee Committee that was set up. All right? I'm sure they're working. I don't doubt they're working. I don't doubt they're planning. It is good to talk about the things that you want to do. If you don't want to, then talk about the things you have done.
Yes. Keep reminding us this is what, and being specific.
Be specific.
Not just being round, the government has talked to industries.
Not
Because
that.
yesterday's briefing, when I was listening to Dr. Mercy Mongangi, she started by talking about what the government has done broadly. I think we need to be very specific and say X number of hand sanitizers from that Kenya Pipeline deal have been produced. They have been distributed here,
and
here
here
and there.
specifically.
X number of garments that have been produced at the EPZ facilities are being distributed here and there. X number of secondary schools have been identified. Now I've seen a list today of the number of bed capacity in secondary schools and institutions around the country that have been identified as isolation facilities. Talk about that here and say, each county, this is what they have. This is our total bed capacity so far. Now, beyond having just the bed capacity, this is what else they need. Do this 1,000 bed capacity, they'll be served by this number of medics. Give us those details. That's what we need to hear. It gives us that sort of reassurance that, yes, we are ready. So government has done its part. It's for us now to also do our part. Wear a face mask, wash your hands, keep your social distance, ensure that you're observing all the guidelines that have been given to you by the government. If you don't do that, man, we are left in darkness.
It's not even that. This isn't requesting for something that needs to be done specially. It's been set in motion. Things are being done. The government has the capacity to state it, to tell it, why is it not being done? Because these are the things that allay fears. These are the things that give hope and tells and communicates to the people that something is being done. Because now we have a situation where the counties are actually outshining the national government.
Yeah. That's the thing.
They are showing that they've got their acts together. And they're doing what needs to be done. And that is a good thing that they're doing. I read today, even Nyandarua County has already come up with something they're going to do.
Yep.
We heard about how the Murang'a counties, all these governors are going to come up with something. This is something they should have done a long time ago. There's something Governor Joe said yesterday that got me really thinking. It was an off-the-cuff statement. He said, these are things we leaders sometimes we are at the heart of this problem.
Yeah.
I listened to it and I said, this guy is actually speaking from the heart. Meaning, but these are things we could have done anyway.
It's like he was having a soliloquy.
Yes, he was. But why are we waiting for this to happen for us to do this? We could have done this a long time ago. And then you chimed in and said, look at what happened to Boris Johnson. He went to St. Thomas. You know why? He knows very well whether it's St. Thomas or whether it's St. Anne, they have the capacity to deal with it.
Yes.
They know. And every former provincial hospital, sub-county hospital in this country can have the capacity to deal with this. And we've had years and times in which we could have done these things. Now, this is the time when we say, okay, enough of this talk. Let's do these things that we could have done and should have done. If I could have, should have, would have.
Yeah,
Right.
all those shouldas. Coulda, shoulda. I'm going to read you I got this information, coming in from the number of isolation centers that have been set up across the country, right? Quite a number, but not being communicated enough. Many of them. So where is this? Get open. Total bed capacity across the country, okay? 138,220. Number of isolation centers identified across the country, 460. This is
Sites.
across the country. Cluster 10, so each cluster.
So that bed capacity is bed capacity of hospitals or bed capacity of isolation
the
centers?
isolation centers,
Okay.
right? So people test positive, you remove them from the community, you take them to an isolation center. And these isolation centers are, secondary schools in most of them. So looking like a county like Wasingishu has 8 isolation centers. Those are schools: Moi Medical School, University of Eldoret, Eldoret Polytechnic, Moi Girls, Eldoret, Hill School, AIC Chebisas, like that. Wasingishu County, 1,712 bed capacity. Trans Nzoia County, 1,478. West Pokot, 3,130. Baringo, 2,710. Nandi, 2,018. Turkana, 799. Elgeyo Marakwet, 3,154. So the entire North Rift region has 15,000 isolation beds ready,
That's comforting.
identified. Going to Nakuru County, 4,305. Narok, 1,600. Kericho County, 3,300. Laikipia County, 2,500. Samburu County, 1,479. Cluster 2, South Rift region, 16,453 beds. Nyanza, Kisumu, 3,200. Siaya, 5,100. Homa Bay, 4,300. Migori, 3,900. Kisii, 3,700. And Nyamira, of course, 2,187. The entire Nyanza region, 22,000 beds ready for isolation. Just going like that, across the country, that's why we get 138,220. This is being coordinated by Dr. Eva Njenga, who's the chair of the Kenya Medical Practitioners and Dentists Council, as well as the head of the National Coordination Center for Isolation and Quarantine Facilities. Structures are in place, work is being done. This is not the information that we are not getting from Mutai Kagwe on a daily briefing.
Now tell me,
We should be.
were these institutions built after COVID-19?
No,
No,
these are schools.
they've been in existence.
See,
They're
but the school has been in
schools,
existence.
yeah.
Yes.
They
Our
have been
point
there.
exactly. We have the resources. When you tell people we have the resources and where they are and what they can do, people feel, oh, all is not lost. This desperation that you keep seeing goes down.
Yep.
The crazy steps down. Okay? It does. It does. The madness that is there, that arises from helplessness and this suffocating feeling of knowing what, not knowing what to do.
Yep.
It goes down.
It goes down.
Yes. Information. Craft it well. Structure it well so that people hear it.
And then go beyond that and tell us, so we have these beds and this is what we need now for the beds. And
Yes.
this is now what you need to do. How shall you end up in the isolation facility?
Precisely.
It's not the cops that will come and pick you up. This is a process that's going to happen.
The cops have their role, let them play their role.
Yep.
Okay? And you say, in this facility, this is what we have in place. If it's food, it is this.
Yep.
And any of those institutions usually have a clinic for the students.
Yep.
Expand our capacity.
Yep.
There's so much that we have. We are not talking about
We have
it.
everything
We are
going
not
for
utilizing
us.
it. And we have it.
28 minutes to 8 o'clock. This is a Situation Room. Shortly, we'll be talking to Joseph Owoho in Atlanta, Georgia, USA. Let's take a look at traffic.
Are you ready? Okay.
Spice.
Not much on the roads in
FM.
terms of traffic today. Everything seems to be moving very smoothly. Mombasa Road looks very good. Very little on the way into the CBD, connecting then with Langata Road and Gong Road on the other side. Coming out of Westlands and the thicker superhighway, no issues this morning whatsoever. You're likely to see a little bit in the evening, but for now, all looks very good as we're getting into Easter. People are going to be sitting at home this time, and it's not your normal Thursday evening rush. All right, we'll have a look at other parts as the minutes tick by. See anything we should know about? Let us know on Spice FM KE on Twitter.
Sugar and spice and everything nice. Spice FM.
Spice up your life. Mature, intelligent talk every morning. Spice up yourself.
Kenya's biggest conversation, looking at all matters COVID this morning. And as we were talking a few minutes ago about what the situation is in the United States, we're joined on the line now by Joseph Uwoho, who's a medic just outside of Atlanta, Georgia, in the U.S. Joseph, good morning.
Good morning to you.
It's nighttime in your neck of the woods, we know. Thanks for staying up to talk to us this morning.
Thank you so much.
I'm in the studio with Eric. Fine, thanks. I'm in the studio with Eric Latif and Siti Muga, and we're opening up the discussion and wanted to find out really what is going on. We're getting so many reports about the percentage of deaths being much higher amongst the African American population. But before we go to that, can we look, maybe you can give us a situation report really of what's going on. We see quite a high number of deaths coming out of the US, higher number of infected cases, and many cries that the system might crack at some point.
Yeah, it's true. The numbers keeps on going up. I think the government did a little bit of some mistake. I think we had a late start when the first cases were reported in January. The United States is a big country, and there were several states, and it's headed by the federal government, who is the president. Many states are independent from each other, but they take cues from the federal government. So until the federal government gives them the green light to act, they tend to drag their feet. So there was lack of preparation from the federal government, and the first cases appeared in January, but the head of the federal government, who is the president, told us, oh, this is just like regular flu, and we hope it's going to come and go. Everything is in place. We are suspending flights from hotspot areas like China and Japan, and like that. And people took it easy, and life kept on going on. And before we could know it, it spread in bigger cities and states like New York and Washington, and it just got out of control. So right now, the hardest hit state is actually New York, that have recorded probably the highest number of deaths and the highest number of infections, followed by state of Washington in the west, and then Florida, and then Louisiana in the south. Other states are seeing sporadic outbreaks here and there, but those are the biggest hit states. And right now we have everybody has been ordered to stay home unless you are an essential worker. And many people are trying to hit that. So we are seeing kind of like leveling of the infections here.
Right. And so are we seeing that people are taking this seriously? People are adhering because of seeing the leveling. It could be that people have taken this seriously and said, you know what, we got to stop this thing. Is that the general attitude from what you've been able to see?
Yeah, many people have taken it seriously now, because when they see the death toll and the lack of preparation from the government, lack of equipment, lack of protective garments, gloves, masks, ventilators for the very, very sick, it scared everybody. And the government kind of like talked people into stay home, and they even volunteer to pay for people who are actually agreeing to stay at home.
Right.
So the government is literally going to pay them their April salaries if they agree to stay at home.
Right.
And many people have actually decided to take that offer.
It seems surreal to people in different parts of the world that the United States, of all the countries, could be in a situation of unpreparedness and then inability in terms of capacity to have this taken care of. It seems weird that they would say we lack, or we don't know, or we are unsure,
It's a shock to everybody, and right now there are calls from all over that we need kind of like an inquiry to find out what went wrong, who knew what, and who did do what. So we hope when the dust settles, we get to know where the mistake was. But it's a shock to everybody that hospitals don't have ventilators, and the ones they had probably have never been used for years, and they're defective, they're not working, and that's why we see a lot of deaths. And currently we are trying to import some from China, which was the epicenter of the thing, and many Americans are normally very skeptical about things from China anyway.
Joseph, what's the mindset of the people when people initially heard that COVID-19 is here? Were they mistrusting or distrusting what the government was telling them, or did they take that in their stride and agreed that this is something that's happening and we need to take action?
American culture is very interesting. Until they see action or until they see something in practice, they try to dismiss things. Many of them were saying, because during this time we normally suffer from flu, just regular flu. So many people are saying, it's cold season, it's just going to be another flu, and it's going to come and pass when the warm weather comes in.
Mm-hmm.
And when the doctors started telling them this is different from the flu, because flu affects one part of the lung, this one affects both lungs, that's why it's very fatal. And they started seeing the deaths rising up and the equipment not being there, then people started taking it seriously. But it was too late. Many people shall have gotten infected.
Yeah.
And then another drawback, we did not prepare with the testing kit. So you don't know whether somebody sitting next to you is infected or not.
Right.
Joseph,
but with the stay-home order and... go ahead.
Sorry, go ahead, finish. Stay-home order.
I'm just saying with the stay-home order and social distancing, we are seeing the numbers begin to level down,
Okay. I was going to ask you to paint for us the picture. You are a medic. You're working now. You're in the front line of this war against COVID-19. Paint for us a picture of what's happening in the hospitals, how people are turning up, what condition they are in, how fast or slow they are deteriorating, and how the medics are coping with it.
It's kind of very interesting because many people present with different symptoms. Some people may come with maybe low-grade fever. Some people come with cough. Some people come with maybe just complain of soreness. Like we guys in Kenya, I'm from Kenya originally, but they're just regular symptoms you see when you have got malaria. So somebody may come with those symptoms, and many medical personnel were misdiagnosing them. Doing regular testing for flu, which is this the flu season,
Okay.
And many of them missed it. So somebody goes home, and then when you go home, you get worse. When you come back, it's when they get a second thought. Now let's try to see if it is a COVID-19. So many people missed it a little bit, and apparently, one bad thing is hitting the low-income people more than the high-income people, because the low-income people generally stay in more concentrated areas. They get less medical attention. They tend to generally have maybe low educational level. They tend to do frontline job, like customer service. They work in grocery stores. They do bagging. They do cashier work. Or when they work in the hospital, you are going to find them doing the frontline work like nurses' aides or housekeeping or things like that. And they get more exposed to more, and that's why you see there are talks about the disease affecting more African Americans than the white people generally.
Right. So it's a combination of factors that's leading to the deaths being higher among the African American community.
Yeah, it's a combination of factors, but it boils down to educational level and economic level, and then of course maybe with the economic level will bring to things like your prior health condition. Were you seeing a doctor before? Do you have other comorbidities? Many people tend to be having other underlying problems like diabetes, high blood pressure, and obesity, which of course 90% of Americans are obese anyway, and majority of them are minorities that are obese. And if you have got other underlying lung problems, you are going to get hit more than anybody that probably was active before.
I think this is where also our colleague here, Siti Muga, was raising the issue. If you look at the percentages of people who have, these conditions, it's almost the same in terms of the blacks, the Hispanics, and the non-Hispanics. So why is it that then the blacks would get a higher effect from COVID-19?
Yeah, just what I was saying, that they get exposed more because they do more frontline work.
Oh, I see.
Yeah, like if you go to a hospital, you're going to find most of the nurses' aides are black people. The managers are white people. So who is going to get in contact with the patient first? It's the doctor, and then of course that nurse. Yeah, and then the manager, the CEO who is sitting up there, who is white, may not even see that patient, so he's not likely to get infected. But if you go to like a grocery store, let me say like Kenya, you go to Nakumat, if Nakumat is still there. The cashiers there are going to be frontline workers who are going to be getting other customers coming in that may be infected. The manager who is sitting upstairs in the offices there may not get in contact with the infected person. So
Right.
that's why my block people are getting infected because of being the frontline workers.
You know, the examples that we've read in the media, Daktari, were referring to pre-existing health conditions. And if we were to go by that, then we would argue that the Native Americans tend to suffer because of the background of mistreatment that they've had. They have similarities in pre-existing conditions with people who belong to the black community. Would you say that they too would also be in danger? Or should I say greater danger?
Yes. Yeah, they could be in greater danger because, as I've said, lack of better education, you don't get better access to healthcare. You are supposed to be doing your annual physicals. If you don't have a better job, you can't afford to see a doctor. If you are not sick, just go and see a doctor for a checkup. And if you don't see a doctor for a checkup, you maybe have a lot of underlying problems that may go undetected. So you find many black people have got a lot of underlying problems that go undetected because they don't see the doctor regularly because of their economic and the educational level. Not that they are not educated, but majority of them are like that. We have very educated black people here, but many of them are doing low-level jobs
Right.
with maybe just high school diploma, just something like that.
So one could probably argue that the pre-existing condition is more social than it is medical, isn't it? A long history of mistreatment, a long history of discrimination, a long history of underdevelopment, a long history of etc., etc. Would you say so?
Social injustice.
Yes.
Yes. You can put it like that too. Yeah, you can put it like that, yeah. So,
You know what?
but it's manageable. Many cities.
Sorry, Dr. Sorry to interrupt, but please say what you wanted to say.
I'm just saying it's more manageable if you have got a better health condition. If you are healthy before, you are most likely to survive than if you had other underlying problems, diabetic, heart condition, and things like that, yeah.
Let me ask this question, Daktari. Remember the 2018 Spanish flu?
1918.
1918. Did I say 2018?
Yeah.
Yes, you did.
No, I meant 1918. 1 century ago. That was probably what has been documented was the last time America had to deal with something of this nature. And it killed,
that is in the book of history and
yes. I'm now speaking as somebody who reads a little history, not as somebody who has a medical background, which I don't. Yes, I am simply saying that even then, if you look at the way the citizenry or the counties, not even states, dealt with it, they understood the principles of isolation. They understood all these things that we're dealing with now back then in 1918. Why would you say that 100 years later, when we're faced with something similar and with all the development and all the progress that we've made, that people seem to be hesitant in applying things that have worked in the past?
Yeah, I think some of it was I can say, bring it down to greed, whereby you have some governors did not want to close their states because they fear losing business. And they thought they could just ride it go on like that. And that's why they were waiting for the cues from the federal government, and the federal government did not act in time.
Yeah.
Because even right now, U.S. have got 51 states. I think there are 8 states that have not been locked down. The rest of them are locked down. You don't have to go to work unless you are an essential worker. But we have got 8 states that have refused to lock down completely. It was just until about 2 weeks ago that Florida beaches were still open. Students were still going to the beaches in Florida because that's a source of income for that state, and they didn't want to interfere with that. So it was greed for money that really fueled things. Yeah.
Are they paying the price for that now? Would you say?
And they are paying the price for it right now. Yeah, they are.
So lack of action at that initial stage is leading to higher price.
Yes.
Joseph, would you say? Go ahead. Sorry, go ahead.
A state like California, which actually controls almost a third of the U.S. economy, they closed down in February. they have seen their numbers go down. Actually, they are now loaning out some of their equipments to other states because
Wow.
they started much earlier.
Wow.
Yeah, but you have states like Georgia, where we live, like Florida. Georgia just closed down about 3 weeks ago. Actually, it was today. The governor extended it by another month again. But the whole of February, we were open. We were going about our business as usual. Yeah, so
We've seen here, I mean, if you look at economic approaches and if you look at so many other things that have to do with government, we've seen that COVID has exposed the underbelly. And like we say, we look at the US, I mean, from the cover that we've seen, a pristine cover of a country that knew what they were doing, a world leader. Has it been the same that COVID has exposed so many underlying issues, whether it coming from an economic level or a governance level, about the United States as a whole?
yeah, it has. That is very, very true. And it goes up to the top because of the political leadership that we have. The current president that we have is the kind that does not like taking cues from anybody. If you tell him A, he will insist it's B. So just the fact that WHO told him that this thing was dangerous, he refused to take cue from the WHO Director General.
Yeah.
And he refused to act completely because he didn't want to take cue from anybody else.
Yeah.
Joseph, stay on the line.
And
We want to
the
take a
thing you
short
can
break.
see-
I want us to take a short
Okay,
break,
thank
Joseph. Joseph Owoho is a medic speaking on the situation on the ground in Atlanta, Georgia. He works and lives in the USA. We are with him now on the line. Let's take a short break, take a look at, let's allow Joseph to have a sip of water as we do the same. And then it's 10 minutes to 8 o'clock. Good morning.
Spice up your life.
8 minutes to 8 o'clock. This is the Situation Room. It's Kenya's biggest conversation. CT Muga, Eric Latif Nduokwan. On the line is Joseph Owoho. He's a medical, works and lives in Atlanta, Georgia. He's been giving us the lowdown of what's happening there in America. The reason why we're seeing a number of black people, predominantly black people, dying out of COVID-19. Let's also now talk about what we've been seeing. The story of hydroxychloroquine, CT, ask that question.
Daktari, we've heard of researches being conducted worldwide using known treatments for malaria, treatment for HIV, antibiotics, a combination of all these, all of them at the same time being conducted all over the world to try and provide a plausible treatment for COVID-19. What can you say about this?
Yeah, there's a little bit of some confusion, the use of that, because, America is very complex. Before you start using something, it has to be approved by the FDA, that's the Federal Drug Administration. And I know chloroquine have been used worldwide. they are introducing it to the U.S. The U.S. does not have malaria, but they use it for treating other things, like lupus and things like that. But some group of doctors came up with an idea that it was tried in France, and they saw it working better if you combine it with the erythromycin. The head of the infectious diseases here is very cautious that we have to be very careful the way we are using it because it has got side effects. But everything comes down to sometimes the pockets, because there are rumors, I don't know whether it is true, but there are rumors that the drug manufacturers have infiltrated the current president, and why the president is pushing for it to be used in a wide area. But the scientists are saying let's use it in controlled environment, make sure it is working fast, and when we can control the side effects. But it is something which is being pushed by the president, and many people are against it because nobody knows whether it works or not. Yeah, but we just find it's just that this president that was very unprepared for this. He's trying to get a way out. He's trying to see, okay, we helped with this, we did that, but he was just caught flat-footed. That's maybe why he's making this desperate efforts here,
The president of the U.S. was also heard to state that the U.S. government was going to put out a considerable amount of money towards the development of a vaccine. And certain pharmaceutical companies were chosen to do this. How far has that gone?
The scientist and the head of the infectious diseases is saying that's going to take between 12 to 18 months.
Wow.
The president in his daily briefing is trying to give us hope that it's something that's going to happen very soon, which is a lie. No,
false hope.
Yeah, but he's trying to make us feel good. Today he came out and said that he's just a cheerleader for us, trying to make us feel good. So we don't take, we don't take seriously anything that he says because he's not a specialist.
He's just a cheerleader. He's opened up a new war front. He has opened up a new war front with the World Health Organization. What's that all about?
Yeah, he is at war with the head of the WHO is from Eritrea.
Yep.
And this is a president that normally does not have very high regards for Africans in general. So he thinks the man is inefficient. So I think it's a personal vendetta, but we will wait and see how far it will go, because the WHO warned the US as early as November last year about the outbreak in China. But the president ignored. So he's saying that the WHO gave them a warning but didn't tell them how serious it was. There was no way they could have known how serious it was going to be if it had just started in China. But it's a personal war with Africa. He doesn't have very high regards for Africans anyway.
Right.
Yeah.
It's a real pity when you have a president who behaves like the worst form of leader this continent has ever had, and yet he actually has a very low regard for us. It's his failing. Let me ask you one last question from me, that is Daktari. Do you think the U.S. is actually going to overcome this disease the way China has?
It will, but with a very high cost. Yeah, it will, but with a high cost. We are going to see probably maybe, initially they say probably maybe 100,000 deaths.
Right.
They say that they are lowering the focus to about 60 to 80,000 deaths. That's a very high cost to pay for something that could have been prevented. Yeah,
could have
eventually they will, but it's going to come at a very high cost. Yeah.
Joseph Owoho, thank you very much for speaking to us.
Thank you so much.
Thanks, Joseph.
thank
we
you
really
very, very
appreciate
much.
that. Thank you.
Talk to you guys later. Bye-bye.
Asante sana. Well, Joseph Owoho is a Kenyan medic working in Atlanta, Georgia. He's been speaking to us. He waited up until late in the morning for him so he could just join us and give us this perspective. Interesting perspective of hearing that, and also hearing a medic saying, well, yes, this is something we could have done much better with this. Very, very many states pussyfooted on making the decision to have a lockdown and minimize movement of people, and now we are paying a heavy price for that.
Right.
Just looking at that, I'm thinking, Kenya.
You can draw very many parallels between what he said and what we see happening here. 8 states still refusing to lock down and then the refusal or the the refusal to lock down in the initial stages because he wanted to make a little bit more money, commercial enterprises still being chased and things like this. Does it sound very much different from what we're seeing here?
It doesn't. Just being told, okay, if you don't do this, we are going to have tougher measures. You people, we are going to have tougher measures. Please, come on.
You know, this head prefect conversation, it has to change. When things change, even this conversation will change. And this belief that, well, this is what Kenyans understand. Kenyans can understand anything.
Yes.
They're not limited to understanding just one thing. If you look at, remember before we went into this space of I was talking about the versatility of Kenyans. Look at the energies that Kenyans are spent in circumventing roadblocks. For instance, that energy. Look at the energy Kenyans are spending on social media just to communicate what they're doing.
Yep.
Just look at that energy.
Yep.
These are a versatile people. It means they think in that way. Now, these are people who can accommodate all sorts of ideas. You only need to present it in a way that is acceptable and easy to understand.
Indeed.
And you keep ordering them.
Shauri
They
yako.
will continue defying you.
No, I'd like them to be ordered and directly told on.
They can be.
Let's go to the top of the hour. Today's proverb.
Today's proverb, let me read it for you. It is sweet. It is sweet. Will soon make a goat choke on yams.
It is sweet. It is sweet. It'll soon make a goat choke on
It
yams.
is so nice when you're chewing it, you figure, why don't I just swallow it whole?
Let me just keep taking this thing in.
Then the choking
Shock
begins.
on you.
Shock on you. Suddenly the throat jams up, you're choking, and the likelihood of you dying is really very high.
Keep it right here. Good morning. It's 8 o'clock. Shortly, we'll be speaking with Kwale Governor Salim Mvurya. Good morning.
Spice up your
in
life.
several parts of the city, traffic is looking very good, or rather, because it's not existent, we see the roads looking very good. You can count the people on the streets today. Nothing much happening. We can't say that we have much to report in terms of that. You can get to where you're going really quickly and in good time, but of course, we ask you to be very careful because we know that the propensity to speed then increases when there's less traffic on the roads. We want you to arrive alive, guys. Spice of MK is how you can reach us on Twitter. Let us know what you see in case of any incidents or accidents, and we'll spread the word.
This is The Situation Room, the home of hard-hitting political commentary and penetrating insights about the state of the nation. This is a talk radio experience like no other. The Situation Room, a place for hard truths, debates, and elevated conversations. The Situation Room, witty, political, engaging, deep, controversial. In the room, we have C.T. Muga, researcher, academic, seasoned political observer, a fountain of wisdom in these politically uncertain times. Ndu Oko, Nigerian by birth, Kenyan by choice, communications expert, Pan-Africanist, a truth seeker and believer in people power, and Eric Latin, agent provocateur, the man in the chair,
2 minutes of 8 o'clock.
journalist.
Thank you very much for tuning in to The Situation right here on Spice FM, broadcasting on 97.7 in Malindi, Nyeri 90.9, Eldoret 96.7, Nakuru 96.0, 102.5 in Kisumu, 94.4 in Nairobi, 87.9 in Mombasa. Let's cross over now to Kwale County and speak to Governor Salim Mvurya, County 002. Good morning, Governor.
Good morning. How are you?
Salama kabisa. Thank you very much and welcome to The Situation Room.
Thank you very much.
Now, Governor, Kwale has now gone into isolation since 7 p.m. last night.
Yes.
How is it for you? Do you feel this was a good measure? Do you feel that we should have gone the full hammer and done a complete lockdown?
I think in terms of what the president has directed, this is okay to have the partial lockdown, because the partial lockdown is happening amongst the other measures that have already been taken by government, and I think this is a good step in managing the COVID-19 spread in the county and in the country.
Now, we're seeing that you have one case still in Kwale.
Yes, we had one case. This was a guest from France who tested positive.
Yep.
And this guest was treated at Sambweni Referral Hospital.
Mm-hmm.
And then after some time, we transferred the patient to Nairobi. And then after that, he was transferred to Paris.
Mm.
So the exposure here, I'm assuming that because Kwale only has one case, the exposure here is that you're fearing the exposure from Mombasa, which has many more cases.
Yeah, and also the guest had contact with people when he was in Kwale, so we were also able to put them under quarantine.
Right.
And now with this lockdown, then we are able now to control movement within the county, so that if there are cases from other counties, then we are able to control through the partial lockdown.
Mm. Governor Vuria, we're seeing a number of things happening across county in the country to mitigate and to bring in measures that will help with this fight against COVID-19. Could you give us a snapshot of some of the things that are happening in Kwale County to fight?
First of all, in Kwale County, we have been able to set up isolation centers in our key hospitals. Mm. We are also on the ground doing disinfection in most of the areas, the market centers and other public places. We have gone on also to sensitize our people on the hand washing and social distancing. So this is happening in the county. And this is in addition to the other measures that we have taken at national government and county government for public transport and other measures in public places.
Mm. Do you find that the people of the county are receptive to these measures and doing what they're supposed to be doing according to directives?
Yes, the people are receptive to the measures that have been put by both levels of government, but also we have to continue enforcing, because we also have a section of the population that still requires enforcement. So we continuously monitor on the ground with our officers and also security officers to see that these measures are enforced at all levels.
What kind of enforcement are you having? When we speak to many of our listeners and viewers, they keep telling us about flouting of these measures. One, especially public transport, and also in public places like markets, where traders are still within 1 meter of one another, and markets not controlling the number of people who are entering there.
One of the areas of enforcement, like I give an example of here in Diani, there was a market around a place called Ibiza, so we were able to close that one, and we relocated the traders at another place where our officers went down to even identify and put the traders 1.5 meters apart, and also to make sure that all the traders had a bucket of water and soap in their areas, and because there's a gate, we also control the movement of people in and outside the new market area. Right. Yes.
Governor, good morning.
Good morning.
I am C.T. Muga. I first of all want to commend you for your incredible track record for development, incredible track record for looking after the lives of the people of Kwale.
Thank you very much.
Yes, I have been following your work very keenly.
Thank you very much.
Now let me ask the question. How many tests have you actually conducted within Kwale?
Right now we have tested over 40 people that we have suspected before.
Yes.
And we continue to do that, especially for those that we have now put in quarantine. So we've done 43.
Yes.
And the 43, we are very happy that they have been negative. And yesterday we took samples and we continue to do the testing. So we should be able to get results today or tomorrow for the cases that we did yesterday.
Do you have any plans for mass testing?
Yes, we have ordered for some rapid testing equipment, and once we have them today or tomorrow, then we should be able to roll out mass and random testing across the county.
What is the population of Kwale County?
The population of Kwale County, from the current census, we are around slightly above 800,000. Yes.
Now, as far as I know, Kwale County also borders Tanzania.
Yes.
What measures has Kwale County taken, especially with the fishing community that go into those waters back and forth, and who are very, very likely to be in contact with people who are not necessarily Kenyans, and whose capacity for spreading any, should we say any disease, is usually very, very high? What is the county government doing to ensure that our borders are well protected?
First of all, the border with Tanzania has been closed. And as a team, because we have a team at the county level that plans all these things, we have strengthened measures to do surveillance across the border. We are also working with the Coast Guard around the Indian Ocean to monitor our movement. We have also sensitized our fishermen. So around Shimoni, we have a multi-agency team. The security forces and our teams are also there to make sure that they are able to handle issues around the Indian Ocean.
Speaking of the Coast Guard and the fishermen, there were initial concerns that the 7 p.m. to 5 a.m. curfew would impact heavily on the fishermen who are actually their hours of operation are usually at night.
Yes.
What has the county done to help them with that?
Yes, that is an issue which we are continuing to engage, because remember here we have a tight balancing act. We have to protect our people against the spread of this virus. But on one hand, they also have livelihood. So that is an area that we are still seeing how we can balance the priorities of fishermen and also handle this spread of COVID-19. So we have sent our teams to engage and see amicably how we can be able to resolve that. But as the current situation, there are a lot of patrols around the Indian Ocean, because again we have, we are also near Pemba, so fishermen can easily come to in Kenya from Tanzania. So that is an area also which patrols have been heightened.
You're talking about conversations still ongoing. I mean, it's about 10 days after the curfew came into effect. If people have been affected for 10 days, they still don't know whether they ought to go out to fish and all. Don't you think that is taking a bit too long? I would assume that you have mechanisms of establishing exactly the number of fishermen and who they are, and you can identify them and maybe work with the Coast Guard and the police to allow them to go fishing and come back and just monitor their movements.
Some of these are also on a case-by-case basis. So that is why some of those cases come, they are resolved, and so that engagement is a continuous process, because I know there are some who do fishing during the day. So it's a case-by-case basis, and we've asked the teams to look at it in that manner.
In case things get tighter, with the likelihood of such, with the numbers that we are seeing on an increase, is there something that's going to be put in place in terms of measures to help those who may not then have access to basic things like food and water on a daily basis?
Yes, we have done a quick survey as a county government and also national government, and we have been looking at the issue of vulnerability as a result of this pandemic. And currently we have around slightly above 67% of the households who would be vulnerable because of this pandemic. So we have put in measures to mobilize food items. We have put in measures also to mobilize cash resources so that we are able to support the vulnerable households. And as we speak, as a county government, we've also already engaged our county assembly, and we are reviewing and refocusing our financial resources to be able to have much more resources for food items, resources for water solutions in the community, so that then we are able to provide on the ground support. So I'm sure in the next few days we should be rolling out this particular program.
Okay.
Do you have a fund that has been set up? We've seen at the national level there's a fund that's been set up. Some counties have also come up with funds where counties are mobilizing resources from the community using those avenues. Have you done the same in Kwale?
Yes, we've done the same. We've set up an emergency response fund, and this is where we have advised our partners and well-wishers to make a contribution both in cash and in kind.
Governor, I'd just like to ask, in Kwale County, we have we've read and we've heard of many health practitioners, some who are registered, some who are unregistered, some who are traditional. Some even claim to have a cure for COVID-19, as they claim to have cures for all other ailments. How are you dealing with such people?
First of all, we have we have said it very clearly that we will not allow shrewd solutions like people saying they have a cure for COVID-19. We know globally there has, a cure has not been found.
Yep.
So we have advised our citizens to ignore any propaganda in this direction. Because I remember even in the last, I think 1 week and a half, there was a rumor that some people were saying if you drink black tea before dawn, then you will be cured of COVID-19. So I have even gone. To make a press statement on this to say that they need to ignore all this propaganda. And you agree with me, black tea cannot cure COVID-19.
No.
What channels are you using to communicate to the people? As a county government, you've got infrastructure down to the village level. How are you communicating to the people?
As a county government here in Kwale, we have infrastructure up to the village level. We have village administrators. So what we have done is we have paired, our officers with those of the national government. So they are on the ground. And we also have public health officers in the various dispensaries in the rural areas. We have community health volunteers.
Yeah.
So we have mobilized all these people and put them in teams so that they move around the villages to sensitize people. We have also supported them with vehicles. They mount public address systems and do sensitization in the markets and in rural areas.
In the event of a full-out breakout of COVID-19, Governor, what do you have in place to address that? Say cases just start rising to 50, 100, 1,000. What would you do?
Of course, that will be catastrophic if it raises to that level. But we are also building our capacities in the health facilities to be able to at least handle some treatment in our referral hospital. Because already here we have an ICU facility with 10 beds, and an HDU. So we are mobilizing equipment so that we are able to handle even treatment at this level. We have also identified quarantine centers, like in our Kenya Medical Training College in Musambweni and Matuga. And of course, you've heard that we also have to identify schools so that we are able to prepare them for the worst. Yeah.
We are seeing also that some areas have been identified in Kwale as isolation centers. And from the national side, the numbers that we have, you have 2,436 bed capacity of isolation centers coming from School of Government in Matuga, Kwale High School, Wa Boys, Wa Girls, Kayatiwi, Msambweni Boys, and Kingwede Girls.
Yes.
So in this particular, these are schools, these are institutions. So they have the dormitories, they have the beds. But what else? What else do you need to ensure that these facilities work as isolation facilities for COVID-19 specifically?
First of all, these facilities, for them to be able to effectively be quarantine centers, even though they have beds and all those, they have to be spaced so that the beds that students use is not the same in terms of distance that quarantine people will be able to handle.
Yep.
These areas will also have to be very clean. These areas have to have running water all the time. So these are some of the things that we will need to fix, and we have water boozers also strategically placed to support these facilities in case they don't have running water.
How about medical personnel?
And also, we are hiring actually more medical personnel as we speak. We've already put the advert so that then we are able to prepare for more numbers. So we have already advertised, and we should be able to hire more, around 150 more personnel to handle the situation.
Okay. Governor Asiti had talked about, clearly that it was evident the work that you had done concerning Kwale County over time definitely received a facelift. We heard more about the county in ways that we've never heard of it before. Do you think that COVID presents an opportunity to even see other gaps that may have been experienced in terms of development of the county that can then be realized even after COVID is a thing of the past?
Yes, I think COVID-19 has posed a challenge to our healthcare system, and not just our healthcare system, but integratively the entire development system has been challenged. So we are seeing an area here in terms of expanding, services in water provision in all areas, which we have to put in more resources. We are also finding here the issue of having more personnel, especially public health, putting more emphasis on preventive and also balancing with curative. So these are areas that we are now realizing. I'm sure it's not just here, but in most counties that we need to invest more in preventive measures. And again, the entire area of disaster risk reduction and preparedness. These are now new areas that we need to focus on. So that when we are faced with the pandemic, then we have a standard operation procedure that we can easily invoke and begin to respond. So the area of preparedness is really key. Yeah.
So we know that in a few weeks' time we'll be going into Ramadan, and there are very many Muslims in Kwale County.
Yes.
What kind of preparation do you have as a county government for this period? People will want to have access to food at the end of the day, but also at the same time, it's a time when people like to congregate. What are you putting in place?
I think, as already directed, the congregations have been banned. Remember, we have even closed the mosque and other prayer facilities. So again, during the month of Ramadan, we expect that there will be demand for food items to our people. And that is why we have put in this as part of the mobilization, so that during that time, we can be able to respond, especially to the vulnerable families that are not able to find food around that time. But again, we will need to maintain the issue of social distance. We will not compromise. Because again, we know if we begin now to congregate, then we jeopardize everyone in terms of the infection.
Yes, Kwale takes a very key position in the tourist industry, and you also have other manufacturing industry. You have industries like mining. I want to know, what part are they playing in helping the county of Kwale in alleviating these issues? And do you have a feeding program, and can they feed into this? Can they work together with you to help provide a solution for the people of Kwale?
Yes, what we have done, we have mobilized the entire private sector in Kwale to be able to be part of this team. To make a contribution in any way in terms of alleviating this particular challenge. And I'm happy the response has been very good. We have seen the private sector coming out with, some have made contribution, sanitizers, water tanks. So we've had contributions across the board, and we've also engaged the mining sector here, the base titanium, who are also coming in with different kinds of support in this particular process. So we've not left anybody behind. But I must say the tourism sector is highly challenged. I think almost all the hotels are closed now here in Diani. So we have left everyone to look at what they can contribute in this particular process, and we are getting contributions of different kinds from the different private sector players.
Actually, what I had in mind when I was referring to the tourist sector was, you see, they have something that very few people have. It's called bed capacity. So if you have a situation where many people fall sick and the health facilities cannot possibly cope with, is it possible for the tourists in the hotel specifically at the South Coast to help with this? This is the sort of assistance I was thinking of.
Oh yes, but I think it's been very clear that if hotels are going to serve as quarantine centers, then people go in and they pay for themselves in those facilities. As we speak, there are around 30 contracts that we are holding in a hotel. So already that has they have provided that facility, So yeah, we have around 30 in one of the hotels here that we are holding under quarantine, and they'll be out in the next few days after the test.
Okay.
Is it also possible for the county government, in conjunction with the national government, to prepare and work out package deals with these hotels in the event, just in the unlikely event this happens? Why I'm saying this is because if hotels are functioning at whatever capacity, it means some of their staff will also have an opportunity to continue working. They themselves will be able to continue working. So it won't be a complete shutdown where there's no work and there's nothing absolutely happening. Is it possible?
It's possible for that level of engagement, but I think the situation right now is I see most of them have completely closed, because without Europe, without domestic travel from up country, then most of them are not operating now. But it is possible for that kind of engagement.
There has been some concern that has emerged, Governor, that the national government is sort of holding back onto cash that should have been coming to the county governments, and therefore now county governments are finding themselves being unable to address some of the emerging concerns after COVID-19. Is this the case in Kwale?
We have been engaging the national government in for different interventions. For example, on the issues of protective equipment and other equipment that we require, and also technical support. We have really been engaging on that. And okay, so far we have received some support, but we need more, and we are continuing to follow up. Like I know the testing equipment they were sent here yesterday.
Yeah.
And we are still looking for more equipment like the ventilators. We have ordered, but we have also requested more from the national government. They brought us some when we had the patient here. So there are quite a number of areas that we are still following up with them. They have pledged support, so we are following up. Even in the area of food, we have engaged the Ministry of Devolution, and they are also working out something. They will be coming back to us with a concrete response on what they can support. But of course, especially in a situation that we are in now, where we are now under partial lockdown, then we expect that the national government and the county government will be able to work together to channel more support to these hotspots, and we are still pushing for that.
Excellency, what amount of money are you targeting to actually put together in order to solve or to partially help with the situation of COVID in your county, and how much of this amount have you actually realized to date?
We quickly looked around. We need around 450 million to handle the vulnerability and also have other basic things. And currently, as county government, we can raise 200. When we review our budget, we can raise around 200 million. So the other gap is what we have put forward to our partners, and of course, some of it is equipment from national government. So the moment we receive in kind, then we are able to now take down the 450 to a certain figure downward. So we are able to work around it through partnership.
So currently, what is your deficit?
Our deficit from 450, if we raise 200, then we are talking about 250 million.
Okay.
Yeah.
When I hear you speak, Governor, and when I hear other governors speaking, I'm hearing as if counties have suddenly been rendered like small brothers of the national government. Everything is coming from the national government, and the national government is, of course, taking its time to deliver on its promises. So, like you've just said, you have had discussions with the Ministry of Devolution, had discussions with the Treasury, and all these, you're still waiting for response. Yet, already your county has gone into a partial lockdown. And this COVID-19, if you had 3 or 4 or 5 more cases, you'll not be able to react fast enough as the national government is pussyfooting on decisions.
I think it's not a brotherly, big brother, small brother relationship. I think it's still the functional relationship that we have with the national government. And of course, this pandemic just it baffled everyone in the country. So we cannot say as a county government we can work on our own. Of course, there are those things we can do, and there are those we can't do. We have to seek support from elsewhere. And the reason I'm mentioning national government is because I also know international support comes direct to national government.
Right.
So then we have to put in our case so that we can be part of those who benefit. Remember, we had Jack Ma Foundation contributing quite a lot, and I know there are much more international partners. They do it at the national level. So if we don't engage, if we don't put up our case, how will the international support flow to counties? So I think it's not a brotherly, big brother, small brother, but it is part of what we need to do as a partnership in the 2 levels of government.
If I may add, Your Excellency, the Kwale government, the government and the county government of Kwale relies very heavily on tourism. If you think of the optics of it, Kwale then, if I'm being prescriptive, and you'll forgive me here, must be seen to vigorously fight the COVID-19, because if we don't, then it appears that we will never be convincing as a site that we're able to deal with these things. What we do with this particular condition is part of the advertising that we give to international visitors that this is a county that takes such diseases seriously.
Yes, definitely. I agree with you. You know, we are a tourism county, having been voted in 6 years running as the best destination in Africa.
Yep.
And COVID-19, therefore, is a big challenge. And that is why we are really concerned.
Mm-hmm.
And that is why we want to put everything forward to make sure that we are able to control infection, so that when the situation normalizes, then tourism can be able to be fully advertised with confidence.
Your Excellency Salim Mvurya, Governor of Kwale County, we want to thank you very much for speaking to us this morning.
Thank you very much.
Thank you very
much. And all
much.
the best with all the work that you're doing. Good job that you're doing there.
Thank you very much also for giving me the opportunity to speak to Kenyans on this channel.
Asante sana.
Asante.
24 minutes to 9 o'clock. This is a situation in Kenya's biggest conversation. We take a look at the weather and the traffic, and then we also open up the phone lines for you to contribute. 0719 012 600. Good morning.
Mostly cloudy conditions in Nairobi.
FM.
We had 18 degrees, the promise of showers in the afternoon, highs of 24 and lows of 26. It's sunny conditions in Nakuru today at 18 degrees. Chances of rain in the afternoon with highs of 26 and lows of 14. Nyeri at 18 degrees is mostly cloudy, going into showers, highs of 24 and lows of 16. Eldoret at 17 degrees is mostly cloudy. It will continue this way for most of the day with highs of 27 and lows of 13. Kisumu is mostly sunny now, but that will change later with showers expected in the afternoon, highs of 31 and lows of 21. Mombasa 28 degrees is mostly sunny. Showers forecasted for the afternoon, highs of 32 and lows of 26. Taking a look then into Malindi at 28 degrees is mostly sunny, going to continue that way through most of the day, taking us to highs of 32 and lows of 27. Kampala at 23 degrees is partly cloudy, showers expected in the afternoon. Thunderstorms forecasted for the afternoon, 32 the high and lows of 24. Taking a peek into Johannesburg at 13 degrees, it's cloudy conditions through most of the day, highs of 19 and lows of 11. And wrapping things up in Lagos at 27 degrees, showers expected in the afternoon with highs of 33 and lows of 25. All right, nothing much that we can see on the roads happening right now. We're likely to see the rest of traffic in the afternoon. So yes, Mombasa Road looking very good right now. Coming out into the city centre from wherever it is you're coming in, whatever directions. Of course, we see that this is all slowed down by the measures having been put in place. Things to remember though, if you're using public transport, you need to have a mask on. You need to sanitize before you get in, and you need to make sure that you're not the extra number of the allowed population within these vehicles. If you are, get off. Spice FM KE is how you can reach us on Twitter. You see anything on the roads that we should know about and spread the word? Don't hesitate to let us know.
Classic soul, R&B, smooth jazz, neo soul, and nostalgic ballads.
Make some noise. Yeah.
You're listening to Spice FM. Mature, intelligent talk every morning. Spice up yourself. Mornings done right. 94.4 Spice FM, Nairobi.
This is the Situation Room. It's Kenya's biggest conversation, broadcasting from Nairobi, 94.4, to the world in www.spicefm.co.ke. Also to the world via social media handles, Spice FM KE on Facebook, YouTube, and Twitter. Now let's go to other parts of the world, to Rome in Italy specifically, and we speak to Marco. Good morning, Marco.
Good morning, guys. How are you?
We're
Very
fine,
well,
thank
thank
you.
you.
Morning.
Morning, everybody.
Welcome to the Situation Room, and thank you very much for speaking to us this morning.
You're welcome. Guys.
Marco, you know Kenya very well. You've lived in Nairobi, you have worked in Nairobi, and now you're back home in Rome, Italy, where we are seeing the number of cases rising on a daily basis, the number of deaths rising on a daily basis. Italy is basically the center of the world news currently. How is it for you on the ground?
The situation is actually a little bit improving in the last 3 days. And when I say improving, it means that we have low cases, new cases, and we have less people dying. Even yesterday we had over 600 people died. So the situation is like, the science say it's a little bit better, but, the numbers are not good at all.
Yeah.
So
Marco,
that is the situation at the moment.
right, that's the situation, Marco. And we know that if you look at the beginning of how things kind of exploded, and that a number of people, moved around, and that's how the virus moved essentially. Are we seeing a difference now? I mean, yes, with a lot of people dying, are we seeing a difference now in how people carry themselves with the lockdown in several cities?
Yeah, everybody has been locked here, imagine, from 11th of March. We thought that from Wuhan, it would not arrive here. Or at least it would be like a flu. Many people, they say, oh, it's a flu, don't worry, there is nothing to be worried about. So we have 17,000 people died here.
Wow.
So the situation in Nairobi, in Africa, could be better and could be worse. They are talking about the weather. They're talking about if it's too hot, the virus usually doesn't travel as much as in the cold weather.
Yeah.
So we have to see, because nobody has a cure at the moment, and the cure will come out in 1 year. Even though people, they say, we have a vaccine, we have chloroquine, we have a HIV medication that they can help. Yes, everything can help, maybe. But there is no vaccine before 1 year, that is for sure.
Right.
And maybe one thing, tell me.
Marco, in February and early March, the people in Italy were basically having a laissez-faire attitude, saying, well, this thing cannot reach us, or even if it comes, there's going to be like a common flu, we can deal with it.
Yes.
Was that the attitude with the government as well?
And the government, in one day they say, guys, it's a flu, don't worry. Then it's dangerous. And then after 3 days, everybody goes out and drink. There is no problem. So, the problem is politicians, they give you very funny messages at the time.
Right.
So you just have to be precautious at the moment and just try and be careful about your gut feeling. Yeah. So you try to avoid everything. What is happening here at the moment is that nobody talks to each other. Even when you pass close to each other, you don't talk because you're scared.
Wow. Wow. When people are looking back at how they were behaving before the lockdown and before the cases started rising, Do you feel, are people feeling that some sort of regret that I wish we knew? Had we known, we'd have done better?
Definitely yes, because with all these people, we lost a generation, or we are losing a generation. You have to consider that Italy is the second country in the world with eldest.
Yes.
Yep. Now, we lost most of them, let's say 80%, 70% are old people. So your grandparents, your auntie, that is bad. The difference with Africa, your population is much younger. So you might have that upper hand in which, they are not old, because people that are dying, they have some pathologies, like diabetes, like cholesterol, like asthma. So that's where the virus attacks first, people that they have a problem. Having a young population, it could be a big help for Kenya and Africa in a whole. But it's still attacking everybody. It doesn't look at if you're young. In England, one kid of 5 years old died. In France, a 17-year-old girl died. So it depends how he attacks you. And there is no mercy. Trust me, there is no mercy. The only thing we have here in Europe at the moment, a good health system. So they can't pick you up and they put you under machines. They have all the technology possible. What is worrying me, and you know better than me, is that Kenya has maybe few facilities.
Yes.
And people, they don't go to the hospital and say, oh, we have a flu, whatever, because they're also scared, because the hospital is the main place where you get sick.
Yeah, I mean, talking about the health...
True.
Talking about the health system, Marco, I mean, just from the pictures that we saw in media, was that the situation that, medical workers were overwhelmed with the numbers? They couldn't really hack it. Has that improved? And also then seeing that some doctors and medical staff were pulled out of retirement to come and help out. In addition to that there just wasn't enough space. Has that changed now?
But, the government decided to make an announcement looking for doctors and nurses, and we got a response for 10,000 new doctors, even though we got doctors from Russia, China, Cuba. Some people, they came also from Egypt. So everybody's chipping in, like Qatar, UAE. The problem is that at the beginning, because of this mixed information from the government, so many doctors, they were not wearing masks. They were not wearing gear. We had today 95 doctors died because of that.
Today alone?
Today, no, in the whole.
In total, okay, to date, okay.
To date, yeah. To date, 95 doctors and nurses died because of not proper gears. And we are a developed country, so imagine what an information or misinformation can do.
Indeed.
So your people, your nurses, your medical staff, they have to be very careful because they will get it. And actually, the main virus, or the virus actually sits in the hospital because you cannot sanitize the hospital every single day. So imagine what is happening there. You go inside that you have a headache, you come out with the virus. So you have to be very careful.
Marco, paint for us a picture of how this system is working. You've got a hospital and you've got people who need to be tested, or people who are presenting themselves with the symptoms. What is happening? How do you take yourself to the hospital? How do you get tested, and how do you get admitted into isolation all the way to ICU facility, even in the unfortunate event of the 17,000 who've died? Just paint for us that picture of how it's all happening.
Okay, the symptoms are you feel tired. So if you want to test yourself, try to do 3 or 4 staircases. If you have a little bit of fever over 37.5, if you start coughing, and if you have pain on your joints, these are the signs that you have something wrong. So what is happening here, you call the medical guard, you don't call the hospital anymore, there are certain numbers that you call only them, and you will tell them the symptoms. If they will tell you to stay home and monitor, they will take your number and they will keep on calling you 2-3 times a day to see how you perform. If the temperature goes up, they say 38, 39, most of the time they come, they take the test, they see exactly if you're positive or negative. If you're positive and you have not very high symptoms, they prefer you to stay in isolation at home. because the hospital, they are really full of people, especially people that they are in need.
Yeah.
Right.
Only when the situation is becoming worse, and when I say worse, is your oxygen level goes down. So it means that, you cannot breathe properly. We have a level which is 99, 98.
Yeah.
When it goes to 80, 85, that's the moment that you have to go hospitalized immediately, because you're not able to breathe.
So they come and pick you and take you to the hospital.
They come and take you in ICU, and then it depends which system they want to use to give you the ventilation, which is the oxygen, forced or through the normal oxygen cylinder. So it depends on the person.
So these medical nurses that you call as a first line of people that you are speaking to, are they in a call center? Are they decentralized? Is it per
It's
town?
a call center. It's a call center from the civil protection in Italy. You call them, they have your number, they call you every day, they want to know exactly, they monitor you. So in order that they know exactly what is happening. And one thing I would like to tell you that maybe has not been discussed yet in Kenya, whatever. Life will change for everybody.
How so?
Will not be the same.
How?
To you. Here, when it will open, you cannot go to the bar, to the club like before.
Yeah.
You have to keep a meter or 2 meter distance.
Yeah.
Will not be able to group together anymore. And this situation, it will not change until we find a vaccine, which means we are stuck in certain places. We cannot go and mingle together anymore. And this will be for a year.
That is
so
right now you are under proper lockdown, a full lockdown in Rome and the whole of Italy.
We are locked down. Yeah, we are locked down, and actually yesterday they put another 15 days more because of the high rate of death.
All right.
So we are locked down.
How do people get their provisions?
We get the chance to go and buy provisions, but we are monitored, which means you can buy provision only near to your place. You have a supermarket, you have to go to that one. If they found you that you go on, for example, I don't know, you live in Lavington and you want to go and buy in Westland, they pick you up, they give you a fine.
Oh, really? Okay.
Oh, you're fined.
You're fined.
And how do they know you've ventured far from where you live?
Because they do here we have in our ID exactly the road where you live, the place where you live. So when they see on the ID, oh, you live in Lavington, what are you doing in, I don't know, let's say Westland or South B?
Yeah.
You have no excuses, so they give you a fine.
Yeah. Because you can get what you need. If it's essential services, you need like food or medicine, you can get it in your neighborhood. There's no need for you to be somewhere else.
Exactly. That is the best way they're doing here in order to stop you to roam around like the way you want. And if you're not able to go out, they will come, the Red Cross, to deliver food. Or the supermarket, you do this, pick and pay service. You order and they bring it to you. So they want people to stay home because more you go out, more you get it. And remember, it doesn't matter only for you to sneeze or cough. Only talking to each other, there are these small drops. If you do it, when you talk near to your phone, you will see the drops on your phone, which means when we are talking to people close range, they will get it, this kind of small drops. So it doesn't matter if you're coughing or not. You will get it as much as closer you are to the people. So you have to limit that one.
Marco, if I may ask, how exactly is Italy dealing with a vulnerable population, people who are economically challenged and are not able to afford food?
Now, we have a big issue here. The problem is that 90% of the population is not working. Only few people are working just to keep, this provisions, like the supply of provision for the supermarkets going on, and the delivery trucks, like UPS, DHL, all these people, they are working, because without them, we will be completely stuck. But the problem is people are running out of money. Now, the government here, they decide to give 600 euro, which is about 70,000 Kenyan shilling, to the people who need the money in order to support them. Because the same thing that will happen to Kenya, so many mamantilias, so many people working outside making 100 bob a day. Now that everything is locked up, who is going to take care of them?
Yeah.
people will die or starve. People, they start robbing. Here it happens in a couple of cases that people, they were waiting outside the supermarket and they rob the old people with the food because people, they need to eat. Now, the government has to be behind and say, guys, okay, we give you 1,000 shillings for all the people that they need it. Enroll yourself, show me that you don't have a job, we give you money. Otherwise, these things is going to last, guys. It's not that, when you finish the cases, because what is happening in Italy at the moment, we're already thinking that the second, how can I call it?
Second wave.
The second, exactly, is coming in September, October.
Wow.
So that's why, actually, yesterday, all the schools have been postponed until September. We're supposed to go back next week until middle of June. Now they close everything.
Until
September, there is no school, and actually, September. And actually, in September, they will consider if they do start working. Because, you cannot hold kids in school far away, and you cannot put a mask on the kids. And that is very important also there. Kids, they are the first one, they can get it between themselves. But fortunately enough, they don't get it so badly like us. But they can pass it to the parents.
In terms of
So
in terms of helping people by the government, how long is this likely to hold? Have they said that there will be, help from the government for the duration of this period?
Yes.
Okay.
Exactly. Every month they will revise it, and every month they are giving money to the people. The people that here the system is a little bit different, but they know exactly through a document, you prepare a
They
document.
know who is where and who needs what, yeah.
Exactly.
Okay.
But this has to be worldwide. Everybody has to be helped because we are stuck. We are not moving.
Wow, it sounds like a tough one. We wish you all the best, Marco, in Rome.
Thank you, guys. Thank you, guys, for
You
calling
will
me.
overcome this. We are at that point where we are now starting to, get the point that it's coming, it's here. And the message that you've given us, of course, will go a long way in convincing those who are listening to us that this is not a joke.
Let me tell you, guys, stay home. It's harder. We human beings, we want to be out.
Yeah.
But it's scary because the symptoms are bad, and when you are in ICU, you don't breathe. You cannot breathe. Actually, the patients here, they make them sleep. They put them to sleep. And when you go to sleep, you don't know if you wake up.
Wow. There's a message to ring home, if any. Thanks, Marco, for that information.
You're welcome, guys. You're
Asante
welcome.
sana.
Cheers.
All the
Okay,
best for you.
Marco.
Ciao.
Bye-bye.
5 minutes to 9 o'clock. Good morning.
Classic soul, R&B, smooth jazz, neo soul, and nostalgic ballads.
Make some noise. Yeah.
You're listening to Spice FM.
Sugar and spice and everything nice. Spice FM.
Mature, intelligent talk every morning. Spice up yourself.
It's 3 minutes to 9 o'clock. I heard from Marco, somebody who's in Italy, in the thick of things. He has seen, he knows people who've died. I mean, 17,000. He's saying we are losing an entire generation. Our grandparents are basically just going.
Just giving the thought for somebody who understands Nairobi, understands Kenya, has been here for a while, is sending out that and saying, guys, you need to actually adhere to this. Listen to what they're saying. Listen to what I'm saying, seeing myself in another country where things have gone haywire. And I'm saying you need to take the advice that they're giving you. I understand that they're where you are. And from what I'm seeing here, you need to take it
And you're also
seriously.
saying our government didn't take this thing seriously.
Our government also didn't take it seriously. And look at where we are now.
Here we are.
Yeah.
And they are having a problem with food.
Imagine.
They're having a problem.
Yeah.
The government is doing this, saying this, but people are running out of money.
He even said, with one of the best healthcare systems in the world, and look at how we are struggling.
But remember,
Over a month,
let me say
locked
this.
indoors.
Let me say this. The underbelly of what we have. It's a wonderful health system for the diseases that are common in that part of the world. For this particular one, they
Terrible.
were not prepared.
They were not.
The Western countries, it's only Germany that is showing preparedness.
Yep.
Everybody else was not prepared. And they couldn't have been prepared. They didn't have these problems.
They didn't have these problems.
They didn't
before.
need to deal with them.
But also, it shows you the cost of indecisiveness.
That
When
one,
you're
yes.
indecisive, because the government was, Marco is saying, the government told us this one time, don't worry, it's just a cold. And then they started telling them,
hold on.
hold on,
It's a
start
flu.
taking these measures. And people are thinking,
The thing was escalating.
we can deal with this.
The thing
It was
escalating.
spreading. It was spreading. Coming to the top of the hour, CT.
Coming to the top of the hour.
It is sweet.
It is sweet.
It is
It will
very
soon make a
sweet.
good choke on yam.
It is sweet. Say that, Ndu.
It is sweet.
It is sweet.
It's sweet where
It
we're
will soon. Now,
like a goat. Choke
It
on
will make
yam.
a good choke on yam. And sweet here is not at Niperamenda.
it is what? It's the yam. Coming up to 9 o'clock, we'll soon be speaking to a doctor who's out in the field in Kenya and telling us what she's facing, especially with these now new measures that have been announced by the government. Curfew at night, and now no movement across counties in Nairobi and others, and the 3 other counties of the coast. Good morning.
Sugar and spice and everything nice. Spice and
Let's take it out towards other areas where seem to be having some problems today. Gatundu South Githunguri members, there will be no matatu operations on that road. Ruiru, Nairobi, Thika, Githurai. Those particular circles will not operate. Narogi, Kaka, Chita, all of those are not happening from today due to the government directive. Well, you can't go anywhere anyway. You can't come into Nairobi. You can't go into some of these other counties. So those have all ceased operations from today. So if you are planning to go to what is Nyamakima to get a matatu to go, you can't. It's not going to happen. And so they're letting people know that this will not happen today. Matatu routes going towards Thika town as well are not quite sure where to stop and where to start. So they've decided to cease operations as well, affecting traffic. There will be a lot of foot traffic from what we see today, depending on how far you actually want to walk to get to where you're going. Other than that, the roads look good, guys. Spice FMKU on Twitter. If you see something else out of order, let us know. We'll spread the word.
This is the Situation Room, the home of hard-hitting political commentary and penetrating insights about the state of the nation. This is a talk radio experience like no other. The Situation Room, a place for hard truths, debates, and elevated conversations. The Situation Room, witty, political, engaging, deep, controversial. In the room, we have C.T. Muga, researcher, academic, seasoned political observer, a fountain of wisdom in these politically uncertain times. Ndu Oko, Nigerian by birth, Kenyan by choice, communications expert, Pan-Africanist, a truth seeker and believer in people power, and Eric Latin, agent
Where are you?
provocateur,
Are you
the
moving?
man in the
Are you
chair.
moving? Stay where you are. That's it. Unless you must move around, don't. If you're thinking of crossing over the 4 counties that have been put in isolation, that's Nairobi, Kwale, Mombasa and Kilifi, please rethink that. But yesterday, when we were talking about these measures, remember we also saw some emerging concerns. Somebody who has been attending clinic somewhere, prenatal or antenatal clinic, and they still want to cross over, and it's across the county boundary, and now they're wondering, so what do I do? Also, curfew comes in at night, and we've heard of many cases where people need medical attention, and they're fearing to come out. And what happens in that case? Let's talk to one doctor who has faced this firsthand, Dr. Janet Gethenji. She calls herself Daktari wa Mtaa. Good morning, Daktari wa Mtaa.
Good morning, Eric.
Karibu katika huu mtaa wetu.
Asante sana, nashukuru.
Good morning.
Good morning to you, love.
Why do you call yourself Daktari wa Mtaa?
I call myself Daktari wa Mtaa because, simply put, I am interpreting the health messages in a language that the public will understand. So, especially, I use Sheng because I am very concerned, because it's the majority of the population and they would need to understand some of the medical jargon being given around, so that we can be able to break it down into simple, understandable language that now we can be able to actually get feedback from and also understand what's going on.
What's your specialization?
I'm an obstetrician gynecologist by profession.
All right, so it's OBGYN.
Yeah.
I can't say that obstetrician word. It's too long.
OBGYN. OBGYN is fine. Yes, OBGYN is just as well.
So, Dr. Gethenji, you've had some experience with these new measures that have been put in place, the curfew and the stay-at-home orders.
Yes.
What's happening on the ground?
You see, I understand very well and I understand fully that is what needs to be done. But then also at the same time, we also do realize that even when we do certain measures, then we also get some challenges. Like, I'll give you a case in point. When we've gotten curfews and also restricted travel, it is not lost on the doctors and also the healthcare people that you see, like, number one, patients who used to come at night for emergencies, now they no longer have to use, they can't use Uber because it's not there at night. If you've tried to actually call for an Uber at 5:30, the network is not on and there are no cars available. So supposing you've got a woman who is in labor, what happens? Just last week, I had a patient who came to our facility. I work in Metropolitan Hospital. So there's a patient who apparently labored all night in her house. And she couldn't come to hospital because, A, she didn't have a car, and 2, they had to wait for the curfew. So until now, the curfew time is when they had to call a friend of theirs so that they could come to hospital. And when she came in, she delivered her baby in less than 5 minutes.
Wow.
So you can imagine if there was a 5-minute delay, she would have delivered on the road.
Yeah.
And not only that, you can imagine there's that afterbirth where it is actually a patient begins to bleed.
Right.
There is a condition called PPH, which is one of the number one killers of pregnant women. So as soon as she delivered, she started to bleed. So thank God she had arrived at the hospital and we were able to sort her out. But the question is, what if she was in Jogorod or Ruko Hamza Makadara on her way? And that's when the baby came,
Aren't these one of the extenuating circumstances, Daktari, whereby, or one of those services where the government has said, in cases such as these, then somebody is able to move on the roads? And if we are not aware, who then can we ask to make it clear?
Now, that is why I'm actually appealing even to the government to actually, probably even give it and assure the public and make it more clear for them that they can be able to come to the hospital, because people are also operating in fear. You can imagine even you still don't know whether you need to move around.
Yeah.
Even for the doctors, they're having to move around with their stethoscopes, their lab coats, their job cards. You have to kind of totally prove
like
that
a doctor completely.
you have to look like you're a doctor. Almost, you won't even wear your mask and cape and everything. You have to walk around looking like almost like the doctor superhero to, because anytime you meet a roadblock, you'll still be scared. So you can imagine if that is the feeling as a doctor. How about a regular Kenyan who is in labor, or someone who's having very severe stomachache? How do you get to prove that, So you see, at the end of the day, we need to kind of establish which emergencies are emergencies. At the roadblock, I'd expect the police might not really know for sure that this is, like a diabetic coma or things like that. But we need to kind of figure out how people who are having emergencies are going to be handled, and the public needs to understand that if they are unwell, they shouldn't stay at home, because otherwise you're going to start having collateral damage from diseases that would have been ordinarily been sorted out, but because they're afraid to move around due to the curfew.
Does this also not expose our healthcare system, for example, or even calling for a change in our attitudes? We have local dispensaries or local health centers close to us. Isn't it about time that we started identifying where they are and knowing that in the event of an emergency, you just rush there instead of crossing over from Eastlands to go to Westlands for a medical facility?
I hear you on that. And if anything, and this is my personal opinion, coronavirus has opened up a lot of health debate, and it has probably made health issues to even now be highly magnified. It was already one of the agendas that the president had put up in terms of universal health care, and have been following it up again also still on a personal level. But I feel like now the issues of our health systems have really taken center stage. And it's not something that we can solve right here, right now, because even in that dispensary, it requires supplies, it requires healthcare workers, So these are things that we keep on saying we need to push to make sure that health workers, qualified health workers of good cadre, are actually placed even in those level 1 facilities. It is a large debate, so that if Westlands dispensary is right there next to your home behind, you can go quickly instead of having to cross around.
Also, let's talk about the kind of collaboration that's being called up for private hospitals to work with the public sector in dealing with COVID-19. The other day, there was an appeal, sort of an appeal from Health CS Mutahi Kagwe saying, private hospitals, look, you're receiving patients who are coming presenting with COVID-19, and you're charging them still exorbitant fees. What kind of thing? What do you think needs to happen here, and how should it happen?
Well, I know that this is a pandemic, because there are certain things which you can say that these are facts. This is a pandemic. That's one fact.
Yes.
Private facilities also usually operate. It's a business where it has got supply and demand and costing of different things. For them to be able to sustain, because it also hires its workers, it has to pay its workers. At the end of the month, these health workers who are also coming in the middle, working in the middle of the night and, sacrificing what they're having to do for the sake of Kenyans. They'll also need to be paid. So some of these things that even they're having to charge is because they also have got bills to pay at the end of the month. Because if this nurse who works in, say, Nairobi hospital, at the end of the month, she's expecting a form of stipend so that she can also take care of her family. And also buy food and put in her house just like everybody else. So it is something that there has to be a balance somewhere. For me, I would wish that, yes, that there be a balance, and I'm happy that they're still at the table, and of course they continue to communicate and negotiate. But we need to now begin to, as Kenyans, begin to understand and look at the other person's side as well. Without necessarily looking at, you guys are overcharging, and then also to the private sector also to realize, this is also a pandemic and it can affect all of us. So it's a question of patriotism. I think Corona has brought an issue where we have to think about the next neighbor without delay.
Indeed. Dr. Rumta, you call yourself Dr. Rumta because of communication, and you find that it's important to break down medical jargon to a language that's easily understood. Let's look at the communication for COVID-19 from the government perspective. Do you feel that it's being done well, or should it be broken down further, and how can that be done?
I feel like they are doing a very good job. But under the circumstances, I have got to applaud the government's effort, because this is not something we have had, even in our generation. I'm sure between you and I, we have not had a pandemic. We have not had to deal with a pandemic before. We are also cognizant of the fact of the things that we have and the things that we don't have.
Will remind you, we have dealt with the pandemic.
HIV was with us, still is with us.
Exactly. Yeah, but I'm sure personally I was much younger then. I would not comprehend what the impact was, and I'm only reading it in history and in our medical books.
Okay.
But I can say the circumstances, they're really working with what we have, and we really, they're doing a good job. We could do, of course, much better if we had more equipment and had more PPE kits for our healthcare workers, if we had our ventilators and everything. But the biggest arsenal we have, and that is what I'm also preaching on my platform, is prevention.
Mm-hmm.
Let us all go out in masks. Let us have good hand washing hygiene. Let us sanitize. Let us maintain physical distance. And I'm telling you, we are going to help flatten the curve. So an example of now what is flattening the curve, you see now that to the regular layman might not understand what it means.
Yeah.
So I've gone ahead and last week I had a meeting with one of the virologists and research scientists called Dr. Masika. He's on my platform. And we sat down and we drew a graph and we explained it in Sheng what flattening the curve means.
Right.
Just so that the public can understand where do they plug into this flattening the curve scenario. What is it? And once you understand, what is my role in it? How can I help flatten the curve? So that is what now, trying to use the medical science to the public to understand how they fit in the grand scheme of things.
With this messaging, first of all, congratulations for merging what you call natural sciences with social sciences.
Yeah.
What size of population of the citizenry do you hope to reach with this very invaluable messaging?
I would wish to reach as many people as possible. Right now, I'm still using only the social media platforms. And I would wish to even this kind of partnership like now we're having with you, or even on mainstream media, to just be able to be a part of the solution. Because it's enough that, yes, I know what flattening the curve is, but if I sit with that information, it doesn't help me. But if I'm able to impact on another, 100 views or 100,000 views, and they all understand, and then they sit in their little, in their chamas or in their base huko mtaani, wana discuss, mliona ile kitu ya flattening the curve inamaanisha hizi ndio kesi na hii ndio time. Lazima tuende pole pole. Even if they understand just that much.
Okay, let me ask more specifically. You know the population of our youth in this country.
Yes.
Now, the sort of social messaging probably targets people who are younger. Is that not so?
Pretty much, yes.
So this is really the population that you want to reach?
Yes.
Yes. Now, why I asked about the numbers is because when you know the numbers, it is easy to tell, for instance, what you'd need to do over what period of time in order to sort of saturate the message. Because if you target this population, even people who are not in that population will get to understand it.
Absolutely.
Yes. So I'm talking about a targeted approach. That is why I asked about the numbers, because social media has a reach that is also known. And it's a wonderful platform.
Yes.
Now, going beyond COVID, because the other diseases that we have did not take a holiday. They are still in place.
Absolutely.
Do you have plans to use this same platform in ensuring that the same communication that relates to other diseases is also conveyed through the same platform even after the advent of COVID-19?
Indeed, because even before Corona, Dr. Romta was still in existence. I was still spreading health messaging of different diseases even before Corona. And we still have got content for other things, including even how to save a choking baby, how to save people in emergencies, how to save people in road traffic accidents. We've been doing these things and we still have that content. It's just that now Corona has come in and we are really having to also continue because it's a fluid situation. Corona is changing. Even we find that we are shooting the videos and we find that today we had 122 cases. At the end of the day, there are 140 or 158. Now we are at 179. Today it's going to be different. So Corona is rapidly evolving, whereby we cannot in the middle begin to add all this other messaging right now until we first of all saturate, as you said, the population with we need to flatten the curve. Once we get that in motion, then we can now proceed to the other content.
Dr. Janet Gethenji, Dr. Romta, thank you very much for speaking to us.
Thanks, Dr.
Thank you very much for your time.
It's a good job you're doing with your platform, Dr. Romta. Where is it? On Facebook and YouTube, or where is it?
On Facebook and YouTube, Instagram and Twitter, and also our YouTube channel.
Okay.
Yes.
Asante sana, and keep doing what you're doing. It's a good job.
Asante, nashukuru.
Thank you.
17 minutes after 9 o'clock. This is the Situation Room. Is Kenya's biggest conversation. 0719-012-600. Spice FM KE, Facebook, YouTube, Instagram. And also you can post your comment on YouTube, where we are live streaming. Remember, this is the first and only radio station that's giving you an audio-visual experience. When we tell you we are live streaming, we're not just live streaming audio, we actually are live streaming video as well. So you can watch the show wherever you are. Good morning.
Classic soul, R&B, smooth jazz, neo soul, and nostalgic ballads.
Make some noise. Yeah.
You're listening to Spice FM.
It's 19 degrees and mostly cloudy in Nairobi, likely to be this way for most of the day, and showers expected later on. In Nakuru, we're seeing sunny conditions at 19 degrees. It's going to come down with showers in the afternoon, highs of 26 and lows of 14. Nyeri is mostly cloudy at 19 degrees and showers expected with highs of 24. Eldoret is mostly cloudy, highs of 26 with cloudy conditions in the afternoon. 24 degrees in Kisumu and mostly sunny. Showers will rule the afternoon with highs of 31. It's 29 degrees and mostly sunny in Mombasa. Showers welcome in the afternoon. 32 degrees the high and lows of 26. It's a warm day in Malindi at 31 degrees. We're going to see highs of 34 today. Cloudy conditions in the afternoon with lows of 27. In Kampala, it's partly cloudy. Showers expected later with highs of 27. Dar es Salaam is mostly cloudy as well. Thunderstorms forecasted for the afternoon with highs of 32 and lows of 24. Johannesburg is cloudy at 13 degrees. Partly cloudy conditions to continue throughout the day. Highs of 19 and lows of 11. Lagos at 27 degrees is partly cloudy. Showers expected in the afternoon with highs of 32 and lows of 25. Take a quick last look into New York at 9 degrees. It's clear skies. Showers expected in the afternoon with highs of 17 and lows of 5. Paris is sunny at 11 degrees, highs of 26 and lows of 11. And wrapping things up for today in London at 10 degrees, it's sunny conditions throughout, highs of 22 and lows of 9.
Spice up your life. Mature, intelligent talk every morning. Spice up yourself. Mornings done right. 94.4 Spice FM.
Who needs to access medical services in an emergency situation, and because of the curfew, they are fearing getting out of where they are. So they've already done everything. They're obeying their curfew order. They are staying indoors, and they're required to get out. And they're wondering, okay, so what do I do? And this is a case where the government needs to come out clearly and clarify and say, in the event you need this and the other, you can come out. And this is what the officers on the road, if you find any officer on the road, this is what they'll require of you. Because it should also be very clear. Don't just go and say, nataka kwenda hospitali. And so a cop looking at you is wondering, so how do I trust that, you're not just flouting the regulations.
But in the case of a woman in labor, it would be clear
That is
what
clear.
she was going through at that
Yep,
point, and they
yep.
should be able to let her through. Yeah, true. Those indications and there's certain circumstances under which it should have been made clear at the time of curfew or even time with the further measures that this in cases like 1, 2, 3. I mean, if someone's having a heart attack, for crying out loud, yes, they need to be able to be taken to hospital, and they don't have an ambulance
A
facility,
child is
for
sick.
example.
You don't
A child
really
is
think
sick,
that you need to take them to hospital, but you just need to get them their medication.
Right, there you
want
go.
to run to the nearest 24-hour chemist.
In some cases, I think those then should have been laid out clearly because, like you said, I don't have a headache and I'm going to want to go to hospital, right? There are certain circumstances that require you to be in a medical facility. And if it's past curfew time, then I think that should have been clearly communicated and said, in circumstances 1 through 10, then it is, you may get into a vehicle or whatever means you need to get yourself to hospital. And the officers on the road should then be able to listen to you.
But in the cases where we are seeing the day before yesterday, people spent the night on the road, right? Trying to cross over from Nairobi to areas that are beyond what is now called the Nairobi metropolitan region. And roadblocks had already been set up. The Rift Valley Regional Commissioner, for example, had already said this is going to be in effect at 7. The order says 7 p.m. So 7 p.m. we're going to set up our roadblocks. And people were caught up because they were heading home. They were thinking, all right, so I'm just 500 meters or just a kilometer away from home, and I need to cross over and go to my home.
No.
No what?
They shouldn't have been on the road anyway.
Out there.
No.
They
shouldn't have been. I mean, if we start to mix issues and start to say, okay, but maybe, no, then no. You shouldn't have been on the road. Forget it.
You're asking Kenyans to actually change the way they think, not what they do.
Yeah.
What they're doing is a reflection of how they think. And this is not at some Kenyan. We've wondered. Remember this debate we've had is we keep electing new leaders. They're Kenyans.
They're not like Ugandans and they say we bring them in.
Yes,
or
they're
Congolese
Kenyans.
and say come and be
Please
leader
understand,
for a
they're
while.
Kenyans.
We're not importing them.
No. So that habit that you saw, the deplorable habit you saw, when you remove this other one and you put a new one,
you'll see worse.
You're going to see the same thing, if not worse. They're Kenyans. And why am I saying this? It's not that we're a helpless, hopeless lot. No, we are not. But there are certain traits we've imbued over time because there's no school you're taken to taught this. But we learn by observation, and people realize when I'm in leadership, this is what I must do for myself while saying I'm doing it for my people, for my community, and what have you. But they're Kenyans. Please understand. So even as you think of having new leaders, they're Kenyans.
Pushing boundaries is our thing.
It's Kenyans.
Literally.
This thing of you're being told move the market and telling what?
It's
Why?
our thing.
Go away. We are not. And you think that you've put roadblocks. We'll cross around you. We know this route better than you. Those are Kenyans. It's how on earth do we change our mindset? How do we understand?
We as Kenyans.
Yeah, everyone. How do we get to understand that this isn't business as usual? This one, all our lives at stake. Research projects are being conducted. The people who've compared, for instance, in the US, the 1914 to 1919 pandemic. It was Spanish flu, and they found that the counties that reacted quickly to the pandemic and stemmed it economically revived themselves better, quicker. Because if you suffer immensely from this particular attack, even economically, you will not remember. Economically, it refers to people being well enough to do what they were doing before.
Yeah.
Now, if people die and a large population of people who were productive are killed or are disabled, what do you think is going to happen to your economy?
Down, nosedive.
Now, Kenyans the one thing everyone can do without too much problem is social distancing. You don't need to buy it. So you don't even need to argue about it. You just need to learn, just to keep your distance. It's an opportunity of a lifetime. People you don't want to talk to, okay? Husbands you are tired of, wives you are tired of, children who bother you with requests. Under the rule of social distancing, you can do wonders.
I'm telling you.
But what is important is you will stay well. Social distancing,
Armed
something
with
that
a- armed
every
with-
Kenyan can do.
Armed with a directive even from the government. saying,
Yes,
look,
and you can the government.
has said,
Government.
not
If you
me.
have to talk to me, you have to be at least. You can even add your own 5 meters away. Okay. And at which point you'll have a deficiency in hearing, and,
and I
it's
say, I
justified
actually
that
didn't hear what you
say.
said.
Louder,
So let's
please.
continue this conversation later.
Later.
Send me a message.
Send me
Social
an SMS.
distancing. SMS me, please. And at that
Oh, I
point,
haven't seen it.
yes,
Network. The network is cramped.
Eric, the opportunities that
Endless.
COVID-19 provides are so immense.
Endless.
If you feel you don't want to pay, no one is going to ask you. You can say,
Why didn't you pay?
This COVID is serious. It even affects the phones. Huh?
That's what I'm saying. Network jam.
Everything is possible, but social distancing, folks, something we can all do.
We
Just
cannot do
obeying
it.
those regulations. So we're seeing images that were appearing even on KTN News last night and even being replayed this morning. People going to shopping facilities, and you've been told that wear a mask. And somebody is going to enter a shop, and the security are saying, if you don't have a mask, please, you're not entering. What do you mean?
Exactly that. You don't have a mask.
No.
I mean, exactly
my
that.
point-
Nataka kwenda kununua huko
My
ndani.
point, yes, exactly. It's
You
for
don't have
your
a mask.
sake.
It's
It
for
is-
your good.
The
If we go back to
they'll come up with an argument.
if we go back
I want to,
to
go in there to buy
inside there to buy something,
the mask.
if you remember what Governor Joho said yesterday, he said, you know what? Even if you don't want to protect the people around you and those you love, think about the ones
That love
who
you.
love you.
Please.
Think about the ones who don't want you to disappear. Think about the ones who need you around. Think about the ones who also now depend on you. If you're not thinking about yourself,
Joho-
think about them.
Joho was very.
He dropped
came
some,
up- he
he
came up with
dropped,
some
he
gems
dropped some
yesterday.
gems yesterday. He absolutely did.
You don't love yourself. Fine.
But we've got that.
There are people you don't love. Fine.
We've got
okay.
that.
There are people who
Who love you.
Okay.
Yeah.
Just a little detail.
Please,
I mean,
for their sake.
Yes.
why is it hard? And then you see some people, even when I think about it and I get tired, you climb a hill to be able to get into the county, and then you say, yeah, I've reached Uhuru Peak so that I can show people, actually tell me
I
about
crossed
COVID. I'll
over.
show you I crossed over.
But-
Are you kidding me?
No, but look at what is happening. It's not the crossing over. People are rejoicing and damning instructions from the government.
That's it. This government thinks they can show us, because the gentleman actually said it on that clip. This government thinks they can show us. We'll
Uhuru
be the
and
ones
Akula
to
sausage.
show them on a cooler sausage.
Nachapati.
Good
Sausage
grief.
at the party, State House.
I don't
I
understand.
think I'm doing this because
I want to show you.
Him, he
eating
doesn't have to worry.
sausages
to
in-
spy to Uhuru.
Yes.
Oh,
Meanwhile, you
Nakula
die.
sausage. You think I cannot cross? I'll cross.
And yet, do you see how damning it is?
telling
This
you.
thing is actually meant for you. It is for your health. It is for your benefit, not anybody else's.
I mean, I don't. What do we need to say? What do we need to do?
And how do we need to do this
And
thing,
how do we
really?
need to do it to get people to understand? Right?
That everything you're being told, suspend the fight you have with the government until it's over and we know that we are well. You can pick up the fight later. For now, just stay alive.
Stay
please.
alive.
Let's go to the government. George Natembea is the Rift Valley Regional Commissioner. Good morning, sir.
Good morning, how are you?
Salama kabisa. Thank you very much for speaking to us. This is a Situation Room.
Good morning, sir.
Morning, too.
Bwana Natembea, we saw immediately the president finished giving his speech. We saw a clip going around that you had already organized the machinery to ensure that security officers would be on the ground to enforce the cessation of movement order.
Yes.
But beyond that, we've also seen now social media clips of people complaining that they were caught up in that order. They were trying to get home. They work in Nairobi and they live in Machakos, or they live beyond Isinya in Kajiado, and they wanted to go home. And they're wondering, so what do we do, Bwana Natembea? Should we not work?
No, that problem where people were stuck in Nairobi was sorted out. You had the Minister for Interior saying that even those enforcers suppose it's common sense. Because if somebody lives in Eldoret and was traveling to Mombasa and is caught up in that river, you are telling him to go back to Nairobi to go where? So they were allowed to travel to go to their destinations, and I think that problem is completely solved by now.
Okay.
So there's no miscommunication then from the directive and then to the officers on the ground in terms of what is supposed to be happening.
No, officers on the ground, we appreciate the reality on the ground. Once a directive is given, you find the best way of implementing it. Nothing is cast in stone. Yeah. Because even that day, the material day, there were so many vehicles coming from Nairobi and there was a logjam.
Yes.
Vehicles could not stand, they could not move forward. So we allowed them to move forward. And that problem was solved. The following day did not go to Nairobi. Yeah.
But on a daily basis, Bwana RC, there are people who, for example, live in Moore Hills and they work in Nairobi. And the roadblock is placed at Small World.
Yes.
Now, on an everyday basis, how are we sorting this out?
People need to understand what the president said. The directive was there's no movement into and out of Nairobi. Yeah. So if you live outside Nairobi and you work in Nairobi, you have to choose either to work from home, or if you're in Nairobi, your employer should organize for you a place where you're supposed to live and stay there. Because the essence is not to move this virus from Nairobi to other places, or from the other place to Nairobi. And this virus moves inside the human body. Yes.
I want to ask a question then, coming from citizens' point of view. If they're saying literally, like giving another example, we gave the example of the cement company here in Athi River, and you live literally a stone throw away, as in you take a footpath to get to the factory. But according to the boundary, you're between counties. What do we do in that case where there's no directive and you're coming to work in a factory on a daily basis? What happens in those cases?
People are told to scale down the operations. No, we are fighting with a very serious pandemic. Between saving lives and producing cement, which is more critical.
Well, there you go.
Yeah. So we are not going to die because we're not producing cement. And this problem, this restriction movement just for 21 days, then it will be reviewed. You can't go back because of 21 days. Yeah.
Bona RC, I'm seeing a comment here, a question that's been raised on social media. Somebody has posted it to us and saying that yesterday they were heading home in the evening. They found a roadblock at EPZ along Kitengela, on the road to Kitengela.
Yes.
And they were stopped by police officers. And this was at about 7:30 p.m.
Yes.
But the boundary, as they understand it, for the Nairobi Metropolitan is way past Senior, and they live in Kitengela. So they're wondering, why is a roadblock being set up at EPZ at the river instead of at the end of the boundary?
What were they doing on the road at 7:30? The curfew starts at 7. So that roadblock is to enforce the curfew. Not the restricted movement. The one that restricts movements at Isinya is not in Kitengela. So the one in Kitengela is about the curfew. So by 7, whether you're living within Nairobi or outside Nairobi, you're supposed to be in your house. Not on the road.
So it's not. So in this case, you're saying it's not a boundary issue, but it was the curfew that we are saying.
The one at Kitengela was for the enforcement of the curfew. Yeah, not the one of the boundary. The one of the boundary is at the end, where the boundary has been put, the metropolitan boundary has been put about somewhere near Isinya. Yeah.
I want to first of all congratulate you for the clarity with which you are expressing your views. And I also want to thank you for the work that we have seen you doing. Now, let me ask this question. Yes. What steps has the government taken to protect the police against COVID-19? Because from where we sit, they are even more in the front line than people who are in hospitals.
For the police, since two days ago, we've started providing them with face masks, and of course they're not even sufficient.
Yeah.
But prior to that, of course, we had to provide them with sanitizers, enough water, even where they stay. So honestly, we still need more PPEs for our officers. But most importantly, we want Kenyans just to cooperate.
Yeah.
We don't have to enforce some of the directives which are meant to protect people. People should appreciate why these directives are being given and just abide by them. We wouldn't have to have officers for some of these things to be done. Even now they're using panyaru. You find policemen running up and down chasing people in the villages. That kind of behavior is not very nice.
Right. So beyond Nairobi, where Nairobi borders many of the counties that are under you, let's talk about the other counties and the Rift Valley region. How are those measures? And from where you sit, are you seeing people complying with the measures that have been put in place?
Generally, over 95% of the people are fully compliant. In fact, you listen to Kenya, they are saying that they want a complete lockdown.
Yes.
They seem to have appreciated the amount of the problem.
Yeah.
But there are few people. 9% of 45 million is a very big number. Those who seem to be causing a lot of problems. And with the pandemic of this nature, if not everyone cooperates and abides by this, we cannot win. Because it just takes one person to spread this virus everywhere.
Yeah.
And we've been doing tracing, and I just come to discover that people don't even stay in one place. You find a guy, you're tracing him, he's in Kisumu now. The next time you're tracing him, the guy is already in Kakamega. You trace him, he's already on the way to Kericho. Huyu mtu anaenda wapi? And when you check, actually has been moving like that.
Yeah.
So if that guy is positive, he's moving that virus from one place to another. That's why the government says, please stay at home.
Let's talk about the tracing that you've just brought up, actually, Bonarsi.
Yes.
So security agencies are able to trace people and see this is somebody that we're looking, person of interest.
Yes.
And you can see their movement.
Yes.
Maybe they actually do not even know that you're looking for them.
Some don't. But those whose contacts we have, basically we just call them and tell them we're interested in you in a particular place. You believe you travel from Kilifi on this particular place. It's true. I say, yeah, fine. I travel. Now, can you unaweza kutusalimisha mahali fulani? Most of them will comply. The others would think that being taken to a quarantine place, like being taken to prison.
Yeah.
So they start playing games. They can even switch off their telephones. And that's why we are thanking members of our fellow Kenyans on the ground, because that's very forthright information. Even if you hide, they'll always tell us that somebody who travels a particular place is here and is trying to hide, and been able to smoke out all these people.
Yeah.
I don't believe that anybody who has come in contact with any of these people has been found positive who is roaming out here. It's not possible.
Do you think it would be? Do you think it would be more productive if you did this alongside health workers who would then be able to come and share the information that was necessary to get people to comply?
Actually, when we do the tracing, we do with health workers.
Okay.
Because they are properly kitted. We do in the tracing team. We've got the police. Because some of these people are very uncooperative and we need some little push. We have administrators there, people who understand the areas properly, the chief, assistant chief, and the village elders. And then we have, of course, the intelligence people who have got the capacity to locate anybody anywhere. And then we have public health officials who are properly kitted. They're the ones who actually carry these people and put them in an ambulance and take them to a hospital, to a quarantine place.
So if somebody...
It's a multi-agency team.
If somebody, Bona Natembea, knocks at my door and they are not accompanied by somebody who is properly kitted, somebody who identifies themselves as a health officer or a local administration, I should not accept to listen to them.
Why are they coming to your door?
Some of them. We saw a clip yesterday of officers who are saying that they are from DCI, and they did not have anybody else. They did not have anybody who appeared to be a health worker, and they were saying that they are here to pick up a lady who has been traced.
No. People should not accept that kind of thing. Because we have our chorus here. This team, it has a team of at least 4 people.
Okay.
And they move together, and everybody has got a role. Yeah, because the chief is known by the people, you don't have to say that I'm a police officer. If somebody is the chief and they know the chief, the chief will explain why you are there. Yeah, but just allowing anybody to come to your house and say it's locating you, criminals are taking advantage of that.
Indeed.
So unless people are properly identified and have said we have got police officers, we have public health officials, we have got intelligence people, and national government administrative officers. Yeah, then they move as a team. And if they come to you, they'll have an ambulance.
Okay, they will. Okay.
They'll have an ambulance because now you are if you are a person of interest.
Yeah.
There's the way in which you're supposed to be handled. So there must be an ambulance there. Yeah.
Bona George Natembea, thank you very much for speaking to us. This time we are appreciating all officers who are working very hard to keep us all safe and to help us fight this pandemic. We appreciate the way you communicate. You break down your communication very well. We had a clip of you the other day talking about people avoiding to leave Nairobi and go to Shags and going to Kaplombe to meet their old... Where is Kaplombe?
Where is Kaplombe? We really want to know.
Kiplombe is someplace on the outskirts of Eldoret.
Okay.
It's Kiplombe.
The name just came to my head. There's no that you tell you about Kiplombe.
Actually, let me assist you. My colleagues here don't know, but that is where the government has been targeting to build a 4,000-bed capacity hospital.
In Kiplombe.
In Kiplombe, yes. It's my colleagues here who don't know their country very well.
It's not my country.
It's a good coincidence.
Yes.
Asante sana Bwana Natembea.
Thank you very much.
Nimeshukuru sana pia.
No, thank you very much, sir.
20 minutes to 10 o'clock, right? This is a situation when I'd lost my mic for a bit. I wasn't hearing myself, so I was wondering, am I broadcasting? Am I here? Am I not? That's why. So if you're out at 7:01, go back home. Please.
No, if you're out at 7 a.m., my friend, you'll be arrested.
Let's break this thing down. If the curfew is at beginning 7, it doesn't mean you leave where you are at 7.
Yeah.
Okay? Let's just be safe. Leave at 6. Latest.
Be home. Be
If you really want to be
indoors
clear,
at
leave
7.
at 4.
Yes,
You have
because
ample time.
so now if you ask the question about traffic and all this that will happen because you have a mass, number of people who are headed out at the same time, then yes, plan
Yes.
your journey ahead of time and leave early.
Precisely. If I may add, those who travel by air will know this.
Yeah.
If you're told to report an hour before and you think it is like the local bus, so you can
shall
report
we-
half an
They
hour,
will leave you.
They will leave you. Yes.
18
And then you
minutes.
can plan how you're going to travel.
18 minutes to 10. Let's take a look at traffic shortly.
Classic soul, R&B, smooth jazz, neo soul, and nostalgic ballads.
Make some noise.
You're listening to Spice FM.
Nothing much. A roadblock being erected in Thickertown ward into the city. Well, yes, it's supposedly for the prevention of the panya routes that we've been talking about. So if you're approaching that area, please realize that the roadblock is there. They're going to be asking you a few questions. You might want to be better safe than sorry in this case. Other than that, traffic is moving very well across the city and, yes, into the regions and the country as well. So not much to report there. Remember, you shouldn't be going where you're not supposed to be going. Spice of MKE, let us know what you see. Even later on in the day, we'll be able to help you out.
Mature, intelligent talk every morning. Spice up yourself.
Kenyan and
Mornings.
media habits. Let's have a meeting at 10.
Yeah.
10 a.m.
You
I
leave where you are at 10.
enter the bathroom.
At 10.
At 10.
Where are you? Niko njiani.
Niko hapa tunakuja.
Wapi? Niko
Unajua
karibu.
jam.
Yes.
Kuna jam.
The guy still in his house.
Yeah.
And what about that dog here barking? Siko barabarani. The guy still in his house.
He's at home. Same thing that people are doing when they're found by cops out at 7 and their basic argument is, there's a lot of traffic. I was late at work. You should understand this thing, officer. I'm going home. Finally, I'm going home. Sawa, there's a curfew, but I'm going home now. So you just let me go home. No, that's not the point. The point is 7 o'clock should not find you outside.
7 o'clock should find you at home.
Actually,
Yes.
why don't we make it simpler? 7:15 should find you at home. This thing of trying to sort of like
Beat the clock.
No, it's the mindset of stretching the limits. This isn't the time for it. This is a time for a complete change in the way you think. And you change the way you think, you change the way you behave.
Yeah, we talked about how there it is. Because we said, how are we going to get this thing to stick? What is it that we've got to save? Then for us all to realize the importance of it. So it's not really saying anything that's then going to change people's actions. It's saying something that's going to change the way people think. Because then the way they act then comes about automatically.
It does.
So it's about
does.
changing the way you think to understand that this virus, once again, doesn't move on its own. The virus has to have a host. And so we are the ones who move it. So for trying to get this thing not to move, it's very simple. we don't move. If it's saying that in close proximity, one to the other is how this virus moves, then maintain social distancing. Stay away. And the thing is that he said, you know what? Bwana Natembeya said this very nicely. He said, well, it's not for eternity, man. It's 21 days, they're saying. Let's do this thing for 21 days.
Yes.
Let's all come together, do this thing for 21 days. Let's see where we will be. And then after that, it will be reviewed.
Yeah.
It could be reviewed down. It could be reviewed up. That's fine. However, it will be reviewed after those 21 days. It is not forever. So in the meantime, let's see how we can salvage the situation.
But we still want to play hide and seek.
I mean,
How are police sure that people will not be late for the 7 p.m. curfew simply because of traffic jams
Which traffic jams? No.
on the road?
Mr. Natembeya has given us the cue. Which traffic jams? On which roads?
Why, if you know that there's going to be traffic jam and you're going home?
No. I'm asking a simple question. Which traffic jams? Ever since we had this lockdown, have you seen traffic jams? Is traffic moving? Yes. But do you actually see traffic jams? Hardly. And at what time? Now, if you know there's a traffic jam on your route home, surely it's not a traffic jam the whole day, is it?
no.
Some sections of Mombasa Road get clogged.
They do get clogged, and you likely know why they get. If you're going into town, for instance, around 11 or 12, there seems to be a jam. It isn't a jam. What happens is around that Airtel place, there's a traffic crossing and there's a traffic marshal.
Yep.
And they stop the traffic to allow people
Pedestrians to cross,
Now,
right.
that is what makes it appear like there's a jam. There is no
A
jam.
small snarl up.
It is.
Would these people who are arguing like this go to if they were traveling and they went to the airport, JKIA, and they found the check-in counter has been closed, would they start talking about...
Who are you telling? There's
Unajua
nobody.
hapa Cabanas.
There's nobody there for you to start giving this long story. They've closed. The desk is closed. In fact, closed. You can see on the
So
board
you're
flight
hardly ever
boarding.
late.
So who are you talking to? Them, they finished their work. They've gone.
But then there's
People
no
who are
story.
there, there's no
They will
story.
listen to you
What are
and
you
say,
talking
the
about?
next flight is at this time.
Yeah, they'll say, thank you very much.
Next flight,
However,
so go and talk to one. So end of story.
Yeah.
go to ticketing and pay the fee for,
And then come back.
and then you come. We discuss, and I can ticket for the next flight.
Because the gate is closed.
You can now decide. You want to argue. You're still not traveling.
Yeah.
You can pitch a fit. You're still not traveling.
As you're doing all these things, the plane is taxiing.
Yeah, it's going.
It's
and the
living.
next one, if you continue the argument,
It
will
will
also
also
come,
leave you
come
here.
and go.
And will also be full.
So decide.
Zachary Nakuru, good morning.
Oh, morning, guys.
How are
Morning,
you?
Zachary.
I'm doing well, Marif there. So, it's a long since I talked to you guys.
Are you well, Zachary?
In a while since we talked. I'm okay. I'm in self-quarantine now.
Okay.
Although I'm calling it ferry because I have to go out and look for something to eat and bring to my daughter Isera.
Excellent.
Say
Say hi to
Isera.
Isera. Yes.
Yeah. So, actually, I just want to tell you that even if some of us regular callers we don't call, we are with you.
Good.
And Spice FM has actually redefined radio. This is a community radio, and it has to be recognized as so. And I'm happy that Mwalimu has agreed with me. You remember me telling you that I'm increasing the bureaucracy in my house. That when you want something, you have to write a proposal, giving it specifications, like that. Every man who is running a family has to know that, and also borrowing government's language. That this is good, but it will be done when money becomes available. Do you understand?
Yeah.
By that way,
we wait for the supplementary budget.
The very caucus has to go through. And now, let me congratulate that gentleman, Mr. Natembeya, and also Mr. Kagwe. In fact, we want, when there is a crisis, especially in the African culture, the tone of the speaker, of the messenger, it has to sound elderly. It has to sound or to be authoritative, And those guys have perfected that art, actually. I congratulate them. Mr. Natembeya in particular has been very, 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 very apt in conveying the message that, the government wants, yeah?
Yep.
And I remember that he said that the government is going to act fairly but firmly, And also his tone is elderly, there's that kind of, that aura of being authoritative, yeah?
Yes.
We like that. And Mr. Kagwe should be told that we are going to revisit this issue.
All right.
So, you guys have a nice day, and in case you are bureaucracy in your houses.
Thank you. Say hello to Idera again.
Okay.
Have a good one. 0719-012-600. Final comments for the show today. You can call in and give us the final comments. So we're talking about Kenyan peculiar habits. This is the time when all of us need to put down all our excuses and do what we ought to do. Don't come with an excuse of, I don't have water, so I'm not washing my hands. Don't come with an excuse of, where am I going to get this face mask? If you don't have it, just avoid leaving the house. Find a way of getting a face mask. Look, they're all over. Face masks are there. And you can even make one for you can make sure that you have something that will serve as you wait to get that proper face mask.
But even as we say this, the government needs to up its game once again in communicating. There are many things the government is doing. There are many things they are planning, and these are things that are intended to help the Mwananchi, the citizenry.
Yeah,
they're not saying it loudly enough, so we do not know.
We don't feel them.
They're not giving a plan. On this day, expect this.
Yes.
If you say two things and it's done, people will know
yes.
They'll believe you.
If they say on Wednesday next week, you'll start getting hand sanitizers from Kenya Pipeline, and then on Wednesday,
they're actually there.
And they come and say, so here are the sanitizers we told you
works.
about. On Thursday, we'll start getting the face masks from Kitui and from EPZ. Thursday, here they are.
They are given.
Yes. Robert in Nakuru, good morning.
Good morning.
Good morning.
Good morning.
Okay, so my concern is our young generation, me being one of them.
Right.
I don't really think these things have sunk. You know, and we are living in the movie things.
Mm-hmm.
And in the movie, I believe there's nothing like Corona has.
We lost him. His concern is for the young people. He's feeling like, people are still thinking, this thing, we shall deal with it. We were told by Marco in Italy, Italians behaved this exact same way. 139 cases, 139,000 cases so far, 17,000 deaths.
You know what? When you look at what people are striving to do in terms of you still want to have a party. We had people talk about quarantine barbecue and some other nonsense that was taking place. You want to ask yourself, all of this in the light of what could happen is actually quite meaningless. What makes a difference here is saving life. And I don't think we can say it enough. If we need to sit here from 6 to 10 and talk about how important it is, let's do it. Because it needs to happen. We can't. The time is now. It's not, plan for tomorrow. No. It's now that is this taking place. So I can understand what he's saying. Young people haven't really, grasped the gravity of this, grasped how important this is.
You know
the
why?
message needs to continue.
It's not that they're incapable. What else is baying and clamoring for their attention? And what priority where does this particular issue fit in?
Right.
Illness, does it fit in before or after unemployment? Where does it fit in? Now, in messaging, and this is where, what was that lady, the Dr. Wamta?
Dr. Wamta.
Yes, Dr. Wamta is doing an excellent job in communicating. Now, this sort of communication can be carried out so that it is understood that if you're dead, this unemployment issue won't really matter. You'll be worried about other ecclesiastical matters. This is a message of staying alive. It's not really complicated.
Bottom line.
Staying alive.
Yep.
Staying alive and the saying that there's certain things which you've been ordinarily used to doing that we're saying let's curtail it for a period of time. And I say this again, it is not forever, for a period of time, so that we can ensure that you don't get sick now and you don't die. Let's say that.
And there's no message the government
so that you can then do these other things that you want to do later.
There's no message the government is giving which doesn't work for you. Actually, all those messages work. So put aside what's hindering you from accepting what the government is telling you. Please forget what you've seen the government do in the past. Let every day be a new day. If they lied yesterday, or so you think, believe what they're telling you today.
Today. This one is true.
But the government isn't lying on these things. The government is actually telling you what is true.
Yeah.
And it is in your interest. They may be saying it badly, but it doesn't make it less true.
Let's speak to Mukoya in Thika. Good morning, Mukoya.
Good morning, too.
Good morning.
Good morning.
Good morning. Thank you for the wise words you're giving us. What I can say is that mvunda nchi ni mwananchi na mjenga nchi ni mwananchi.
Kabisa.
And then yesterday there was thuggery in our nearest state, a neighbor. There was thugs who entered, but they were not able to steal anything because of the the neighbor had
alarm raised by
yeah,
neighbors.
Yes. We went there at 10 p.m. So the neighbors came out. We called the police. They said they will come, but they didn't. Then they called me back, telling me they had arrived there, and there was nothing like that happened at the area. But I told the Wananchi, it is upon us. Security starts with us.
True.
So we have to protect ourselves. We don't have to depend on curfew, because even police are not nearest. The curfew, you can't feel it. You can even play football at night at around where I stay, the residential area. Yeah, 10, 11 p.m. you can play football outside.
So it's about the people
Happily.
basically doing what they're supposed to do.
Yes, that's why I will finish by saying.
Say that again. Mvunja nchi.
Mjenga nchi ni mwananchi na mvunda nchi ni mwananchi.
Very true.
Asante sana Mukoya. Have a good one.
Thank you. Nice to.
Thank you.
Thank you.
Good word to end the show with today.
No, lovely stuff.
Explain that to Ndu. Mvunja nchi.
Whoever breaks the inchi and the one who builds the inchi,
they're both
is still a
Wananchi.
Mwananchi. Remember saying they're all Kenyans. All these people talk about, they're all Kenyans.
All the same.
The builder and the destroyer are all citizens. Our today's proverb.
Oh, it is sweet. It is sweet.
It's sweet, oh.
It is sweet will soon make a goat choke on yam.
What's that?
This thing of hii kitu ni tamu jamani tuendelee kula, itafika mahali, you're not chewing it, you're actually swallowing it whole, it'll choke you.
Where is that proverb from?
It's a Nigerian proverb.
Ah.
And what they're saying is moderation is essential. All right? You need to understand that everything has consequences, but the truth of the matter is this. This is a time when we actually need to understand the moderation we require here. That it is sweet, Disobeying the government may appear to be pleasant and sweet, and you'll be sticking your finger up to the government. You're sticking your finger to yourself. The truth of the matter is, what you're being told is true. Listen to it. It is for your own interest.
It
will choke you.
Thank you very much. 6 a.m. to 10 a.m. tomorrow morning, Good Friday. So today is, what was it?
Monday, Thursday.
Or Monday, Thursday.
No, don't put the O in front.
Monday, Thursday.
Monday,
Thursday. And tomorrow, Good Friday, we'll be here again, 6 a.m. to 10 a.m. Do your wise words.
Isolate, sanitize, maintain.
Viva!
Right. In this case, yes, viva, stay alive.
Join Monique from 2 o'clock to 6 o'clock as she takes you home, and then the adults in the room will be here tonight from 7 to 10. Until tomorrow, good morning. It's 10 a.m.